you all for being here today. We have two bills on the agenda, Senate Bill 480 and Senate Bill 433, and we're going to hear the bills in the order that they're on the agenda. I understand that there are folks here today with very strong feelings on both sides of the issue that's presented in Senate Bill 480. As chairman of the committee, it's my responsibility to make sure that the process moves smoothly and that we maintain decorum in the chamber. That's what I hope everyone, that's what I expect from everyone today that's here. To that end, I just want to remind everyone, and someone that's here for the first time, let you know that we have some long-standing rules that we're going to adhere to. The gallery and the chamber must remain quiet. Accordingly, there is to be no applause, no booing, audible talking, or chanting, and signs are not permitted. Anyone wishing to testify should have either signed up remotely or signed up out front. If you signed up on the internet, please check in out front so that they're aware that you're here, and that's the list that we're going to be operating from. And that's the list that I will use to call individuals up to testify. There's another committee that's scheduled for the Senate chamber this afternoon, so we must be out of here by 12:30. And in light of that, because we have so many individuals signed up to testify, I'm going to limit testimony to 3 minutes for everyone. And I ask that you be respectful of that 3 minutes. We'll have a timer, and when the 3 minutes is up, please stop or finish a sentence and then stop. Again, it's out of not only respect for the process, but the individuals that are coming behind you, hoping that they can have time to testify. We will be limiting testimony to 1 hour for the opposition, and then 1 hour for the proponents of the legislation. I will call the first individual up to testify, and then I will name the next 2 people to testify. So the first person will come up to the podium and testify. The people that I name after that will come up, and there are signs to sit right over in against the hall or the wall there in the on-deck position. Doing that will speed up the process and again allow for more individuals to testify. When you come up, I ask that you state your name and who you represent before giving your testimony. And as I mentioned, and I'll repeat it, and it'll bear on the time you take on testimony, that we have a hard stop here at 12:30, and I have 2 bills to hear. So with that, what I'll do is ask Senator Johnson to come to the podium and explain the legislation, and then we will move to the testimony from individuals. So, Senator Johnson?
First, have amendment.
Okay, we have one amendment, and that is amendment number
1.
Number 1. Okay, would you care to explain your amendment?
So amendment number 1 addresses a few technical issues with 480 in the definitions and language there, along with highlighting the fact that we would want to make sure mental health and social services are available to these individuals and that it's spelled out in the language, and that really any other service or condition of sexual development that is unrelated to the diagnosis of gender dysphoria or gender identity disorder is allowable in this. And then the rest of the changes are essentially to make the language in the bill uniform.
Okay, thank you. Are there questions of Senator Johnson?
Move the amendment.
Second.
Okay, may we take the amendment by consent?
Consent.
Okay. Now, I know that Senator Yoder has 3 amendments that she didn't get in time, and that could possibly be my fault, but I told her that I would welcome her to come up, or you can do it from your seat there, to just explain briefly what those amendments are, and you can deal with them later on in the process.
Thank you, Mr. Chair. I do have 3 amendments, and I had a good discussion. Senator Johnson and I have had many discussions about 480, and I appreciate those conversations and did talk to him about these amendments. And one amendment is basically taking the language that Senator Johnson has used for 480 and just said, sort of basically saying all of this care, that gender-affirming care with parental consent. And so it's just codifying into law that gender-affirming care across the board with parental consent. That the state of Indiana does observe parental rights when it comes to gender-affirming care. The other amendment is more in line with what is actually happening, and that is it takes out the language for any surgeries on minors, because we know that in the state of Indiana, those surgeries are not happening. But it does leave in that gender-affirming care, non-surgical, with parental consent can still remain, but that we will not have those under the age of 18 be allowed, as is already happening, to receive surgical care for gender-affirming care. And then my last amendment is strictly just says, using 480, but says we will let emancipated minors, along with adults, those 18 and older, to receive gender-affirming care.
Okay, thank you. And doing it this way, Senator Yoder, you will have the opportunity to offer those amendments at another time in the process. So,
I will offer those during second reading, should it receive a vote out of this committee.
okay, thank you.
Thank you.
Dr. Johnson, or Senator Johnson.
Either way works, Chairman. Thank you. Chairman, thank you. Members of the committee, being a physician does demand that I approach this issue with the utmost respect, care, compassion. I acknowledge the emotion around this issue, and as you said, I would urge those present to be respectful during this process. SB 480 is a prohibition on the use of gender-related medical and surgical procedures on minors. Unless specifically prohibited for the purposes related to gender transition, the bill allows for all other medical and surgical care a child could need. I want to be clear, this bill allows for important counseling and mental health care to continue. The bill allows for a 6-month time frame to transition off puberty blockers or hormones. This bill has been worked on in this body for the last several years, and the discussion predates my time here. As I've walked through this, I've been committed to meet and discuss this issue and engage with people on both sides. There are many here today that have been a part of those discussions, and I do appreciate your input. We have not gotten to this point lightly. The physical and mental well-being of Hoosier children is a priority for this legislative body, and we are working toward that goal. This bill is common sense, public policy to protect Hoosier children from irreversible, unproven, and life-altering procedures. As a father, as a doctor, as a state senator, I have compassion for every Hoosier. I have taken 2 oaths in my professional life, one as a physician and one as a state senator. I take both oaths very seriously. I take both oaths very seriously, protect life and liberty, to do no harm, and to help those in need. This is a complex issue, but ending these irreversible, unproven, and life-altering procedures is the right thing to do. We hear stories from adults about their regrets and about the harms done to them as minors. Just in the past few weeks, a nurse whistleblower publicly came forward to describe the harms to children at her gender clinic. In some of the most heart-wrenching cases, we hear stories of patients taken advantage of as minors, harmed and abandoned by gender clinics. The time to act is now, and this bill is clearly the right thing to do. You will hear suicide brought up repetitively in this discussion. We acknowledge there is an increased risk of suicide at baseline in kids with gender dysphoria. This is likely due to underlying comorbidities and mental health concerns. We very much want that to be addressed. Our goal is to help, not harm. There is not quality science to support these medications and procedures to produce long-term improvement in mental health. The science really shows the opposite. Other countries have recognized this and are swiftly backtracking from puberty blockers, hormones, and surgeries on children. We have the utmost compassion for these children, and there is a pressing need to protect these vulnerable children from irreversible, unproven, and life-altering procedures. A child cannot understand the weight and permanency of the decisions. That is obvious. How can a child understand the ramifications of this on the rest of their life? We should focus on what we can do to support the whole mental and physical well-being of the child, given the pressures put on parents, the irreversible nature of these procedures, and the unknown long-term effects. There is no such thing as true informed consent. It would cause far less harm for these kids to wait, get the counseling they need, and then let them make these life-altering decisions as adults. We have the medical, moral, and legal obligation to protect Hoosier children. We have a surge of procedures that lack scientific support, exponentially growing in our nation and in our state. I encourage you to join me in protecting Hoosier children by supporting this bill.
Thank you. Yes, Senator Yoder.
Thank you, Mr. Chairman. So in simple terms, Senator Johnson, what is your hope to accomplish with this legislation?
I think I defined our goal here really is to cause less harm and let these kids wait and get counseling they need. And that'll protect them from these life-altering decisions until they're adults.
So how many of the surgeries are being performed on children in the state of Indiana?
I'll let those clinics and surgeons discuss that for themselves. And,
I think you and I were both at the same sort of roundtable discussion with the major clinic for the state of Indiana at Riley Children's Hospital, and they said zero. No surgical interventions are performed on minors. So if in fact it is maybe the non-surgical, then I have been thinking about this tirelessly, and that sounds like you have been too. And if, as you say, you're trying to carry out your oaths, both as a physician, as a senator, I think the easiest sort of visual for me is based on what we know from peer-reviewed articles, studies, research, data. If you, just for ease of sort of visualizing this, if we have 100 adults, because this is questioning adults, just like you were referencing, if you have 100, 94% of those, so 94 of the 100 reported having received gender-affirming care, reported mental well-being, happiness, the ability to pursue, liberty, ability to pursue their best selves, sort of the American dream, and 6%, if you want to just, so 6 of them, 94 are tremendously helped by, I'm not even going to talk about the surgicals, we don't perform surgeries on minors in Indiana. So 94 of the 100 is life-saving, is helping them do what you hope happens as a result of this bill, 94 of them. 6 of them decide differently. So let's talk about that 6. 94 helping, 6 not. Those 6 matter, I get that, those 6 matter. Let's break down those 6 individuals. 4 of them,
Senator Yoder?
4 of them.
Do you have a question?
Yes, I do have a question.
Okay.
4 of them choose a life of just living gender nonconforming, of the 6. So that's down to 2 out of the 100. So if we had, I was trying to get Skittles to show this. So if I had 2 Skittles here, of the 2 that would choose a different path and change their minds, let's say that, 1.5, it's 0.4, but 1.5 for ease of math, 1.5 of 1, change their mind due to pressures from parents. And 0.4% change their minds due to the fact that they wish they hadn't. Does that 0.4 matter? Absolutely. But we're talking about care that we can get into the statistics of how those seeking gender-affirming care are helped by this care. We can talk about that, but that has to do with all but 0.4% of 100 individuals. And I guess I want to know, as a physician, I mean, you read these, I would imagine you get your guidance from peer-reviewed research, whether it's cancer drugs, diabetes drugs, there's always a percentage. I would say 0.4 is probably really phenomenal. But if a parent had a child diagnosed with cancer and wanted to use a drug that was in the trial stage but had a chance for saving their child, would you say we need to write legislation forbidding that, banning that? Would you say the science, it might help 99.6% of people, but that 0.4, it could harm. So we're not going to go down that road. Is that the kind of help you're hoping to achieve with Senate Bill 480?
Okay.
There's a simple question in that, and I think I already answered that. It does cause a lot less harm to let these kids wait, get the counseling they need, and then let them make a decision as an adult. You can throw all the statistics and data out there you want that really is surveys or low quality, but it's just not backed by quality science.
So what are you saying about parental rights here? And what are you saying about parents who are seeking this care, trying to figure out the best way forward for their family, for their child? Would you say that they are bad parents, that they are abusive parents? What is your opinion on parents who are currently receiving this care to care for their child?
Senator Yoder, I've been very patient. If you have a question about the bill, please ask it.
All these questions are about this bill.
Please ask it, and so we can get on to testimony. The longer we spend here, and you've had a chance to talk to Dr. Johnson many times about this already.
But I think the public deserves to know where he's coming from. If in fact, because I did not know that this legislation has been brewing for years, and now we're hearing it, this is an opportunity for Hoosiers to hear. Yes, I've had conversations. We've never actually had this conversation. But I think Hoosiers deserve to know. I mean, this is for parents. I can only speak for parents in my district. This is devastating for them. And we should all be devastated by this kind of legislation. So I would just want to know, for parents, if you're are you trying to help parents? Are you trying to, do you believe that this is abuse? Why we would need to have this bill?
Senator Yoder, I just spent 5 minutes laying out simply, I'm not here to attack parents, and we have the medical, moral, and legal obligation to protect Hoosier children, and that's where I'll leave that at.
To protect the 0.4%?
Okay, we'll be hearing other testimony on these topics, so I'd prefer that we move on and start hearing, and we'll start with the opposition testimony, and the first persons on the list are Tori Castor and Dr. I hope you would be comfortable with me saying Dr. K this morning. Thank you. And then, I'm sorry, on tap, Nathaniel Clausen, and then Emma Visaki. So again, if you would come up and sit on the on-deck bench there, it would be greatly appreciated. Thank you.
Thank you, Mr. Chairman, members of the committee. In the interest of time, I'll keep my comments short and turn it over to Dr. Katzenellenbogen. My name's Tori Callahan Castor. I'm with Indiana University Health, which includes Riley Children's Health. We rise in opposition to Senate Bill 480, and I'll make 2 points. First, our primary concern is we fundamentally believe this legislation interferes with a parent's right to choose the best possible care and potentially life-saving care for their child as it pertains to these services. The other point I'd like to highlight just very quickly, it's been raised, but I think it's important to emphasize to this group, is that at Riley Children's Health, we do not perform gender-affirming care surgeries on anyone below the age of 18. I think that's an important point to highlight because I know there's been some confusion among the committee members and the public generally, so I think that's important to note. With that, Mr. Chairman, in your indulgence, I'd like to turn it over to Dr. Katzenellenbogen.
Thank you.
Very much, Mr. Chairman and committee members. Transgender people are found in every country and culture. In the U.S., a conservative estimate is 0.7% of youth are transgender, or 1 out of every 142 children and adolescents. There are formal medical diagnoses for the persistent distress often felt by transgender youth: gender identity disorder and gender dysphoria. Transgender youth are often so distressed that up to 30% will try to kill themselves. This is nearly 80 times the rate in the general population. At the Riley Gender Care Program, we provide comprehensive care hand-in-hand with parents according to national and international evidence-based medical guidelines. Our program includes medical, social work, psychology, and psychiatry team members. If a family and physician feel that a youth may have gender dysphoria, a referral is made. A family completes an intake packet that's reviewed by our mental health team. If there's an indication for gender dysphoria, they are offered an appointment. The patient and family have an appointment with a mental health professional first, and then a medical provider second. Every discussion of treatment includes the patient and family. No choice is made without adult consent. Our care is always offered with the best interest of the child in mind. Everyone may receive social support. For children before puberty, this is their only treatment. Social support could include using a preferred name, referring to them by their correct gender when speaking to others, supporting different styles of hair and clothing, and so on. For some youth, this support is enough. For others, it is not. Medical treatment is proven to be safe and life-saving. For a patient who has just started puberty, our program can offer pubertal blockers. A patient can use this medication for up to 18 to 24 months, during which time the patient and family would continue social, mental health, and medical support. For a patient already having completed puberty, our program may offer other medical management based on their individual symptoms of distress. When a patient desires gender-affirming hormone and the parent consents, hormones are prescribed at low doses, slowly advancing over 18 to 24 months, with medical visits every 3 months, inclusive of laboratory tests. When someone chooses to stop any treatment, they may do so as our care is offered with the best interest of the patient in mind. No surgeries for gender patients occur before the age of 18 at Riley. And again, we want to reiterate, all care follows the needs of a patient with support of the family. This diagnosis and process is very hard for patients and families. The treatments we offer at Riley improve the lives of youth and their families. Without this program, transgender youth in Indiana will not get the care they need. And sadly, we fear that this may result in some choosing to take their own life.
Thank you.
happy to
Again,
take
I
any
want to
questions.
keep the questions to a minimum in the interest of time. Senator Leising?
Just one question, Senator, and that is, before the children enter, and their parents or whatever enter into the hormone therapy, is there ever an explanation of the type of surgery that will occur after their age 18? You know, the details of what they would experience, because to me, that might change somebody's mind. So is that discussed at all?
When we care for patients in our comprehensive care program at Riley, we are meeting with patients repeatedly. And I would not necessarily say that our patients are 100% interested in surgery. I'd say a fraction of our patients are interested in surgery at any point along their care with us. If someone were interested in surgery as an adult, we would need to be sure that they and the family feel that that is a desire of theirs that's been consistent and maintained. They've completed all of their medical treatment, and a letter of support would have to be drafted by at least 2 providers of that patient with a parent. And then a referral could be made to a surgeon, and then the surgeon makes their own assessments as well, only once they're adults.
Do you make the referrals to, of those that are under 18 to a facility in another state that might do the surgery?
No, we do not.
So you just continue with hormone therapy and say, when you're 18, come back and see us? I mean, is that kind of the way it works?
Patients and families that are in our care and our gender care program see us every 3 to 6 months, so we continue to be supporting them in their mental and medical needs.
Thank you. Senator Becker.
Thank you, Mr. Chairman. I guess my question is, I understood this bill, and I was looking at the first part, so I'm not real sure. What part of the bill actually eliminates your ability to do what you've been doing?
Sure.
Senator Becker, what this bill essentially would do, it would prohibit us from providing any kind of medical treatments to adolescents, anyone under the age of 18. So that would include the hormonal treatments, the puberty blockers, and then the surgeries, which is less of an issue for us since that's not a procedure we provide at IU Health.
So it's the
Yes.
hormonal treatment.
And the puberty blockers, the medical
puberty
treatments.
blockers.
Yeah.
That's what I thought when I read this, but I guess because I'm a little confused, I really think that decisions like this ought to be left up to the parents. I'm trying to glean from this what we're really doing.
Yeah, I think that's the
And
point.
I was under the impression it was just the surgeries.
No, it would prohibit both the medical treatments and the surgical procedures. And I said, surgeries are less of an issue for us. Quite honestly, we feel it's best practice for surgeries to occur until they're after the age of 18. But the medical treatments we are very concerned about.
Thank you.
Just a follow. You do no surgery on individuals here.
We do no gender-affirming surgeries on people under the age of 18.
None.
Correct.
Thank you. We'll move on to Nathaniel Clausen. And again, I think everybody's been told before and now, please, 3 minutes would be great. Thank you. And then Emma Visaki is hopefully here, and then Christina Inskeep next.
Members of the committee, my name is Nathaniel Clausen, and this is my wife, Beth. We are parents to an amazing, energetic, and caring 10-year-old transgender daughter. We also have a 19-year-old son, and we have a 17-year-old daughter. We are here to voice our opposition to Senate Bill 480 on the basis that it threatens our parental rights and our youngest daughter's life.
Starting around 2 years old, our daughter started telling us who she is, but it took us over a year to really catch on. She is the first transgender person we have ever met. At 3 years old, she became depressed and started to withdraw. She was no longer the vibrant kid at the playground who would make friends with anybody. She even occasionally talked about herself in ways that made us scared for her own safety. We realized things had just gotten serious. We went to our pediatrician and spoke to her about how to handle this. The bill before you would have prevented us from being able to have that important conversation.
After much soul-searching and discussion as a family, we let her transition. And I know that's a scary word to a lot of folks, but really all that meant was using the word she and shopping in the girls section at Target. And as soon as we did that, she immediately started smiling again. When we got her her first pair of girls' shoes, she insisted on sleeping in them. And seeing her experience that joy again, and seeing that was just so powerful that it helped us understand how necessary this was for her.
Puberty can be a difficult time for everyone, but my fear is that my daughter will be forced to go through male puberty after she has been living as herself, as a girl, since she was very small. Without age-appropriate medical care as recommended by our doctors, I fear that she will take her own life. Thank you again for this time. Please do not ban the affirming care that our daughter will rely on to live a happy life. Please give her a chance at a happy childhood. Please respect our rights as parents to make private medical decisions with our doctors and to know that this is what is in the best interest of our children. Please vote no on this bill.
Thank you. Senator Yoder, question.
Thank you, Mr. Chairman. Thank you for being here today and for opening yourselves up in ways that can be terrifying, so thank you. When you see language like this filed, what does that do to your family? What does it do to you individually? What does it do to your daughter? So that's my first question. My second one is, if this passes and you want to continue caring for your child, is your option to move out of Indiana?
I'm going to start with the second question first. I have already been in discussion with my company that if this bill passes, we will be leaving Indiana. And my in-laws just moved to Indiana in 2020, and they will be going with us. And, I mean, I don't want to have to flee Indiana, but this care is so important for our daughter that we would have to leave. And to your first question, putting on my suit today, I didn't fit in it as well as I could because I've been stress eating. There have been more tears in my house over the last month than there should be. My wife didn't go to work last Friday because she couldn't stop crying. This bill and these anti-trans bills take such a toll on my family, and it's not just my family. Seeing adult trans people, this just throws back at them as well that, hey, society doesn't really like y'all. And it's been really tough.
Thank you for your testimony. Appreciate it. Emma Vasicki, then Christina Inskeep, and then Katie Blair. And as I mentioned at the start, please introduce yourself and tell us who you represent.
Chairman, committee members, I'm Emma Vasicki. I'm the Executive Director of Gender Nexus, which empowers gender diverse folks and their loved ones to live healthy, authentic, and joyful lives. As a parent, attorney, trans woman, and especially as the Executive Director of an agency where we get to daily witness how gender-affirming care improves and at times saves lives, I am here to express my vigorous opposition to SB 480, in which the state seeks to compel caring parents like the Clausens and expert physicians like Dr. K to deny essential medical care for transgender teens. Folks, at a minimum, 29 major medical, pediatric, endocrinological, psychiatric, psychological, social work, and public health organizations have formally recognized the medical necessity of gender-affirming care for transgender individuals. Detailed research has established the following. A 2022 study published by Stanford determined that trans individuals who began hormone therapy in adolescence were significantly less likely to have thoughts of suicide or major health disorders as they grew into adulthood. A 2023 study published by 9 expert physicians found that appearance congruence, positive affect, and life satisfaction increased while depression and anxiety decreased for adolescents taking gender-affirming hormones during their adolescence. Studies have shown that trans kids have similar sets of familial, social, and educational supports, provided that those supports are not pulled from them. They have the same mental health outcomes as individuals who are not trans. At Gender Nexus, I get to work day in and day out with transgender folks of all ages. I and our agency gets to see in real time the positive differences that affirming care makes and the grievous damage that's caused when it is denied. When affirming care is needed and provided, there is a decreased need for mental health supports. Parents report seeing significant positive changes, with any number of parents saying that this is the first time that they've seen their child happy in a long time, and that they no longer fear losing them to suicide. I am pleading with you on behalf of hundreds and hundreds of transgender folks with whom we have worked and whose joy we have witnessed. Please do not take away another human being's right to medical care, because this will only result in incredible damage and the loss of life. Please let physicians who caringly and carefully apply their knowledge and expertise determine the best course of action as they work together with their transgender patients and their families. Please, I plead with you on behalf of all of these people, do not pass this bill. Thank you.
3 minutes on the dot. Well done. Well done. Thank you. Senator Yoder.
Thank you, Mr. Chairman. Thank you for your testimony. Yesterday in session, we heard a bill that was, I don't remember the number, but it was a residential harassment bill. And we were discussing the right that someone has to be in their home. And I think the words I believe, I was trying to pull this from the words of the author, that an individual should feel safe, have the right to feel safe, free from emotional distress, and free from fear in their home. Since this is our home, our bodies are our home, do you think that that same idea and those principles should apply to transgendered individuals?
Senator, first, I think it should apply to all individuals. And transgender individuals are just another group of human beings who have the same right to feel safe, to feel that they can express who they are. And given the emotional distress at which we have watched for kids who are denied affirming care, I don't want to see anyone else go through that type of pain and grief.
Last year, when we had the discussion on transgendered girls participating in sports, it was in studies that we saw, those discussions when states are discussing those policies, 1 out of every 3 transgendered youth feel unsafe, feel emotional distress, and feel fearful. And do you suspect, and I would imagine that you do, that 480 is doing the same and or worse?
2 responses to that. First, we already know from a survey run by the Trevor Project last year that, and I might have the number off by a percentage point or 2, that 87% of all transgender youth experience negative mental health outcomes just by the presentation of these bills. They begin the same cycle of fear which the Clausens were describing for themselves, that they see their lives suddenly shutting down, that they're no longer allowed to let their bodies be congruent with who they are. Also, these bills do even worse than that. The most recent GLSEN biannual study indicates that 59% of all transgender kids feel unsafe in their schools. It has now risen 9 percentage points to 68%. These types of bills send a message to everyone, and it causes damage, even increasing damage, where kids can't feel safe in their own schools.
Thank you.
Thank you, Emma. Christina Inskeep, Katie Blair, and then Dr. Lauren Bell. And Christina, Emma just set the bar pretty high, hitting 3 minutes on the dot. So
I got you.
Yeah.
Hello, my name is Christina Inskeep. This is my husband, Ken, and we are parents. We're speaking for many parents that we know who are parents of transgender folks. Gender-affirming care is life-saving care. We know because it saved our son's life. Thanks to the care he received, he survived his teen years and now is a charming, handsome young man, if I may say so. If you've never raised a transgender child, you can't know the daily challenges it poses. Every disclosure to family, friends, faith community, and schools, to name a few, is fraught with emotion and the potential for rejection. This is a tremendously difficult path for any family. It's not a journey that anyone takes lightly. It's carefully considered. It takes time. When our child came out to us as transgender as a teenager, he had already been suffering through years of severe anxiety and depression and self-harm. He was hospitalized due to suicidal ideation. Like the many families we know with trans kids, we did a lot of independent research. We consulted with our faith leaders. We consulted and assembled a team of doctors and mental health professionals who had experience with kids, helping kids like ours. Job 1 was to keep our kid alive. If it weren't for the support of doctors and healthcare professionals, we're convinced that our child may not have survived.
We are outraged by this bill, even if not intended. This bill is cruel and it's arrogant and it's It is cruel because it seeks to deny families access to medical treatment that may be critical to saving kids like ours. It is arrogant because it says that we parents are incompetent and unable to make medical decisions for our own kids. And you know better than us what is best for them. It is evil because it sacrifices other people's children on the altar of a culture world in which these families want no part. Cruiser children, our children, will suffer and die if you pass this bill. So if you vote for it, look us in the eye when you do. Your yes vote will tell us that we are bad and abusive parents who are too stupid to make medical decisions for our own kids, that we do not have the right to make the decisions that are best for our family, that instead of their parents, you want politicians and big government to make medical decisions for kids. We are proud that we made the choice to keep our child alive and urge you to protect our parental rights by voting no on SB 480. Thank you very much.
Thank you. Senator Melton.
Thank you, Mr. Chair. Thank you for your bravery. Thank you for your strength and sharing your story. I can tell that you are caring parents. And my question is, what about the children that may not have that support system? How do you think, how do they manage? And how do they get through this if they don't have the parental support and those that may not be able to walk them through this process like you help your child?
As you can imagine, that's really hard. If you don't have a caring parent person, an adult in your life is dramatically harder anyway. If you have one caring person, a teacher, a mentor, an adult, another parent, a friend's parent, a person from one of these wonderful organizations that help LGBTQ youth, one person can reduce the risk of suicide by 40%. Okay, that's one adult. It can be an adult in a school. It can be a friend's parent. It could be us. It could be, like I say, there are many organizations that help youth. Now, the bar is set much higher than for the youth who do not have someone. We get together with some other parents and we try to help parents support their children so nobody's left out.
Senator Yoder.
Thank you, Mr. Chair. I have heard that this bill is in response to parents not being able to tell their children no. I have heard.
Has this been written by a parent?
I have heard that this bill is in response to saving people from themselves. What do you have to say to those individuals who are coming at this thinking that this bill will save people from themselves or be an answer so parents don't have to tell themselves no, the state will?
Respectfully, that is the height of arrogance, and it is suggesting that they're better parents, that they know better. And, you know, we got 5 kids. Anybody with kids, you spend more time saying no than you spend saying yes. And the notion that this is what you want for your child, that, you know, when your kids were born, you're saying, boy, I hope this kid's transgender because that's going to be an easy path. No, that's not what's happening. And as parents, we know so many parents in this situation, and the parents are struggling, trying to figure out what's best, but it's like you heard the Clausens. When they live that experience with their kids every day, who knows better? Imagine if your kid is on the edge and every single day you're locking up medications and you're hiding the scissors and the knives and all that other stuff because you got to worry that they're not going to be alive when you get home. And it's so insulting to suggest that parents are just too damn stupid to be able to do what's best for the kids.
Yes, and also it is a long-term process. As you heard the people from Riley say, it might begin at age 4 that we call Riley saying, uh-oh, what, our child is saying they're transgender, what do we do? But it's a very long process of careful consultation, careful thought and prayer, and it's nothing that is entered into lightly at all. It is, as you see, it already causes a lot of anguish, and we're just trying to do the right thing. So we're just asking for parent rights to consult doctors and do the right thing.
So,
Thank you.
It's a follow-up, just real quick. You said in thoughtful prayer, because I have heard that we are in this situation because of the lack of faith. I mean, that's so painful for me to hear as a person of faith, but you know, to hear that, I think that's really important, that these discussions happen as faithful discussions.
You know, I can't speak for everyone because everyone is different, and there's so many different ways to connect with the divine. You know, I'm not going to speak for everyone, but yes, in our case, we did consult with our faith leaders, and we did our own soul searching and deep prayer every night, I mean, all day long, because you don't know what's happening with your kid. So yes, there are many, many ways, and many faith leaders come on the other side and say, yes, it's our duty as God's children to support our children that God gave us.
I know this is very difficult for you to get up here, and I appreciate you being here and sharing your story. I forgot to ask the other family that was here. How old was your child when transitioned?
So our child was a teenager.
Pardon me?
Our child was a teenager when they told us.
Teenager. Okay, thank you.
But it had been building, I should emphasize. You know, one of our great regrets is that we didn't know more sooner, because we could have saved our child so much grief and not been teetering on the edge. If we, you know, looking back, they gave us so many indications of who they really were, but we just were ignorant.
We didn't know.
And didn't pick up on them. And then once they finally told us, all of a sudden looking back, it was like, all of a sudden this makes a heck of a lot of sense.
Okay, thank you. Thank you very much.
Thank you for the opportunity.
Well, one question.
Sure. We're not talking about personal medical decisions. That's not in
That's
here.
our private.
Oh, I know. I just meant because this. Well, the bill is about taking away parental rights to make carefully considered medical decisions, right? It's saying the state can make the decisions. Big government and politicians know better than ourselves in consultation with our doctors. If our child had surgery, that was their business.
I'm sorry, I see the bill as about age specific, so thank you.
Okay, thank you very much.
No, our child was not a minor when they had surgery, and that's not even done in this state.
Katie Blair, Dr. Lauren Bell, and then Zoe O'Halen Byrne.
Hi, thank you. I have to apologize because these have been some wonderful parents that we've heard from today, and I'm a little emotional. My name is Katie Blair. I'm the Director of Advocacy and Public Policy at the ACLU of Indiana, and I'm here to express our strong opposition to Senate Bill 480, a bill that strips parents of their rights to make appropriate medical decisions with their families by banning gender-affirming medical care for trans youth. Ironically, this bill has been filed alongside other anti-LGBTQ bills that claim to defend parental rights, yet proponents of both bills are attempting to strip parents of their right to make informed medical decisions for their children, making it clear that this is not about parental rights at all. In fact, Senate Bill 480 is part of the slate of hate, a historic number of bills that single out LGBTQ Hoosiers, specifically transgender youth and their families, for unequal treatment under the law. Preventing people from accessing evidence-based, medically necessary care simply because it's a form of care offered to transgender people is discrimination, plain and simple. In addition, Senate Bill 480 exerts state control over medical professionals by limiting their First Amendment right to discuss medical care with their patients, by gagging doctors' ability to discuss treatment options and preventing them from referring patients to other qualified doctors. This bill runs afoul of a doctor's right to freely discuss treatment with their patients. Denying best practice medical care and support to transgender youth can be life-threatening, like you've heard today. It's been shown to contribute to depression, social isolation, self-hatred, risk of self-harm, and suicidal behavior. Medical professionals overwhelmingly support age-appropriate medical care for youth who experience impairment due to gender dysphoria. Regardless of what cherry-picked evidence proponents of this ban might offer, every legitimate medical organization, from the American Academy of Pediatrics to the American Medical Association, has recently released statements in firm opposition on these kinds of bans. The struggle to support a young person who experiences gender dysphoria can be a long and difficult one for any family. And every family takes their own path when dealing with this complex situation. A ban of this sort takes that complicated private decision that some families have to navigate and inserts the control of the state. This is not a Hoosier value. This bill opposes medical science, prevailing standards of treatment for transgender youth, and basic human dignity. Please vote no on Senate Bill 480.
Thank you, Katie.
Hi,
Senator
Senator
Becker.
Becker.
I'm curious, Katie, and maybe Senator Johnson may have stated this when he made his presentation, but I was a few minutes late. How many other states have done this to date?
There are several states have their ban tied up in courts, and several states have bans that do not look like this one.
Okay, so is this, in your opinion, the most egregious?
This is I haven't, sat down and looked at all of those bills, but this is a very egregious bill, yes.
So the states that have passed this type of legislation, is there any of them where they're actually in effect, or are they all tied up in court?
Most of them are tied up in court. Some of them have not taken effect yet. And that's what I know off the top of my head from some Googling. That's widely available on the internet.
Okay, thank you. The other question I have, and maybe I should probably have directed this to Senator Johnson, but does this bill prohibit circumcision?
I do not know about circumcision in this bill and the language. I know that there were some updated medical.
With the Jewish community that was concerned about that, and I missed the earlier testimonies. But it doesn't say it doesn't. It really does not say that. They pointed to 5A, lines 14 through 19. So I don't know if we need to make that clear or whatever, but where is it?
Okay. Senator Yoder?
I just have to say, I've been up here discussing some wild topics, and I have never been asked about circumcision before. Woo! Yes. No.
Okay.
It's good. Well, I mean, yeah, and I think making anything kind of like that is important.
Please. Senator Yoder.
Thank you, Mr. Chair. Thank you, Katie. Thank you for being here and standing for transgender rights. I would ask you, on page 6 of the bill, in line 1 on page 6, section 19, I don't know if someone could give you, it just says, the Attorney General may investigate and bring an action to enforce compliance with this chapter. Can you speak to, as a representative of ACLU, because you were talking about possible litigation, how different than what happens now with Indiana law is that, and is for the Attorney General to have civil investigative demand, is that problematic?
This entire bill is problematic from a legal standpoint. There are numerous areas of this that are unconstitutional, and I'll let legislative lawyers, look at that. The Attorney General, who is the lawyer for the state, determined that. But as my attorneys look at it, they see several areas in which we could sue.
Okay. Thank you for your testimony. I appreciate it.
Thank you.
Within 3 minutes. Fantastic. Dr. Lauren Bell, then Zoe Halen Byrne, and then Dr. Elizabeth Struble. Welcome.
Good morning, Mr. Chairman and members of the committee. My name is Dr. Lauren Bell, and I'm a medical fellow in adolescent medicine at Indiana University School of Medicine. I'm here today on behalf of the Indiana chapter of the American Academy of Pediatrics, which represents over 900 pediatricians and pediatric clinicians throughout the state. Our primary goal as pediatricians is to provide the best possible care for our patients. We rely on evidence-based medicine to guide our practice, and we work closely with families to make sure that we're meeting the unique needs of each child. The bill under consideration today would interfere with this process by preventing physicians from providing evidence-based, age-appropriate care that we know is effective. Gender identity is a core aspect of a person's identity and impacts their mental health and well-being. Denying access to gender-affirming care can have significant consequences for the mental health of transgender and gender-diverse youth. Research has shown that transgender youth have higher rates of depression, anxiety, and suicide attempts compared to their cisgender peers. Providing gender-affirming care has been shown to improve mental health outcomes for transgender and gender-diverse youth, and limiting access to such care will lead to detrimental outcomes. The nation's leading health organizations support gender-affirming care, including but not limited to the American Academy of Pediatrics, American Medical Association, American College of Obstetricians and Gynecologists, Endocrine Society, Pediatric Endocrine Society, and more. The American Academy of Pediatrics has recognized that gender-diverse and transgender youth require specialized medical care to support their health and well-being. Evidence-based standards on gender-affirming medical care have existed for decades. They require medical professionals to carefully evaluate each patient and make individualized decisions in the patient's best interest. SB 480 would undermine the ability of medical professionals to provide this kind of care. By interfering with the informed consent process and forcing healthcare providers to disregard their patients' best interests, this bill would do more harm than good. It would put up barriers to care and make it harder for families to access the services they need to support their children's health and well-being. As a physician working in adolescent medicine, I have seen firsthand the positive impact that gender-affirming care can have on young people. This kind of care can improve mental health outcomes, reduce rates of suicide and self-harm, and promote overall well-being. It's a critical part of providing comprehensive health care to gender-expansive and transgender youth, and limiting access to this type of care is not in the best interest of my patients. In conclusion, I urge the members of this committee to consider the needs of gender-expansive and transgender youth and to support access to evidence-based care. Sorry, I'm also a little emotional from so many really lovely testimonies. As a medical professional, I take my responsibility to my patients very seriously. I believe that parents should be able to make informed decisions about their children's health care in consultation with their healthcare providers. SB 480 would interfere with that process and would put the health and well-being of some of our most vulnerable young people at risk. For these reasons, I urge you to reject this bill and to support access to the care that gender-diverse and transgender youth need and deserve. Thank you for your time.
Thank you, Doctor. Quick questions, Senator Yoder?
Thank you, Mr.
Senator
Chairman.
Becker.
Thank you for your testimony. Do you have parents who force their children to receive gender-affirming care in your practice?
No, we do not have any parents who force. I've never seen that happen. And we require both the patient and the parent to agree. We would never accept a parent to force this treatment upon anyone.
So when you're listing off the many academies that believe gender-affirming care is best practice, evidence-based practice for transgender youth and adults, that's how you inform your practice. I mean, people say, I am not a physician, so I'm looking to you to ask this. People say being a doctor of medicine is just as much an art. I mean, you have to continue to read what's in the literature, peer-reviewed literature. So if you were going to practice medicine not observing the best practices or evidence-based or reading peer-reviewed articles, how are you being informed? Where do you draw your decisions? How do you practice medicine alternatively from that?
I would say some physicians choose not to accept the overwhelming body of evidence and would rather receive their information from other sources. And there are like more respected journals, and then there are also predatory journals that may publish things. So it may be that they don't know how to evaluate the evidence. It's hard for me to know, but I do know that sometimes people are busy in their practice and they're not necessarily up to date on the evidence because they don't have the time. They're just trying to get by to see all their patients, and they're not in an academic center necessarily.
Thank you.
Senator Becker.
So really, if I heard you correctly, you didn't mention every medical association, but you certainly mentioned the top ones are opposed to this bill.
Yeah.
Including the American Medical Association and the Academy of Pediatrics.
Yeah.
Thank you.
Thanks.
Thank you. Okay, Senator Lysing.
What is the youngest age that you have ever provided treatment for in your practice?
Because I'm here speaking on behalf of the AP, I explicitly, we're not supposed to speak about patient characteristics, just to be.
And again, I guess I apologize because I look at this bill, Senator Johnson, as being about very age-specific, and that's why I was wanting to know.
I can guarantee you that no genital surgeries are performed on anyone under the age of 18, and we don't do anything like that for anyone at Riley.
And I understood that what was previously said. I just wanted to know when you actually started treatment otherwise, the hormones.
Yeah.
And I think that's pretty important for all of us since that is a part of this bill. But if you don't want to speak, then
I would
thank
say
you.
also, like, we see people, young people like the Inskeeps discussed, we see young people as young as they are when their parents come to us in need of support and social affirmation to help young people understand who they are in this world. And we're never turning someone away because they are young and want to discuss things. That doesn't mean that we're starting medications on someone. We see people in our clinic for many things that are not medication related.
Y'all get just one quick. I think Senator Lysing asked the question, how young do you start the transition?
Right, but because that's an individual, it's hard to answer a hypothetical since we do everything on an individual basis.
It's not hypothetical.
Yeah.
It's not hypothetical. What is the youngest age that you are aware of that transition started?
Do you mean transition like someone who is wearing clothes that affirm their identity, or do you mean medicine, or do you mean surgery? Can you clarify, or do you mean a puberty blocker? What do you?
I mean any of those. What is the earliest that you've ever started? You're aware of anyone ever starting the transition?
I think. Honestly, it just depends. I mean, I heard today.
It's a very simple, direct question. It's not violating HIPAA or anything else. What is the youngest age that you're aware of that someone has entered into transition?
We all heard testimony today of a 3-year-old.
I'm asking your testimony, and you are here, and you've listed a whole bunch of organizations. What is the youngest?
I think the 3-year-old that I heard today is the youngest, that story that the folks told.
You think?
Yeah, that's.
You don't know.
I feel confident. I'm racking my brain, but in our clinic, we're not seeing 3-year-olds. So I hear stories from families and patients who are not in our clinic, but I'm here again as on behalf of the AAP, and we feel that this is not a decision that should be taken away from families and their doctors.
Thank you, Senator Becker.
Well, I guess the part of this bill, because I guess how I perceived it was we were discouraging or eliminating or making illegal the actual surgery. But you're saying that, and in reviewing the bill, there's a lot of other stuff in here. So you're saying it's a lot of the other stuff in here that's just as bad as the surgical.
Yeah, I would see that the things that the bill is taking away, because surgery is not on the table anyway, are the access to blocking puberty and access to gender-affirming medical care. So, like.
Thank you.
Senator Bohacek.
Thank you. I just want to ask, I just got a kind of a quick one here. Now, in your practice, you guys do prescribe the drugs, the puberty blocking drugs, okay? You know, and you're gonna need to start that 12, 13-ish years old, approximately, or?
So it depends on the individual because everyone goes through puberty at a different time. The general assessment is around when someone has already begun puberty, and that's when we start having conversations, but every patient is on an individual journey, so it's an individual decision made with them.
So are you guys like checking hormone levels in their bodies to determine, you know, when it's appropriate to start, or how do you guys make that decision?
So we assess their puberty the same way that we assess the puberty of any child who comes into our clinic to just see how their development is going with careful physical exams.
Got it. So, I mean, and I'm a father, I've got 3 kids, and, you know, what if this child changes their mind when they're 16, 17, 18, 19? Can they then restart puberty, or is that window been shut?
No, yes, they could discontinue the puberty blocker. The whole idea of a puberty blocker is that it puts a pause on puberty and gives them more time and space, but that when they take it off, they would go back into the puberty that they had avoided.
Have you seen anybody actually do that?
It's very rare. There was a study that came out last year where they looked at a large group of people who had socially transitioned when they were young, 5 years later, and only 1 out of 90 plus people decided to retransition after, and retransition included people deciding to become non-binary instead of being like.
And as far as the puberty blocker drugs being able to be reversible, is there like medical studies on that? Because I'm looking for one, and I'm struggling to find a medical study that shows that in fact it is reversible.
I'm not familiar with the exact literature, so I'd have to get back to you with details, but I mean, it is, as I was saying, it's reversible to take a puberty blocker off.
Okay, so you would just go through puberty when you're 20 years old then, basically?
So, yes, but that is a rare, again, it's not something that and when transgender people transition as adults, they also sometimes go through a different puberty at an older age too, if they were to decide to pursue treatments at age 20 in the first place.
And there's no side effects to any of this treatment?
Every treatment has side effects, and so that's why it's an informed consent process where we talk about risks and benefits of any treatment, just the same as we would do with anything that we give at all.
Thank you.
Okay, thank you, Doctor, for your testimony. I appreciate it. Zoe O'Halen Byrne, Dr. Elizabeth Struble, and then Gillian Province. Go ahead.
Thank you, Mr. Chair, members of the committee. My name is Zoe O'Halen Byrne, and I have the honor of serving as the Director of Engagement for Indiana Youth Group. At IYG, we serve LGBTQ+ young people from the ages of 12 to 24. We see these young people through some of the most turbulent and challenging years of their lives. In the work I do, I am reminded every day that adolescence can be stressful, disorienting, and hard enough for any youth. However, add the distress of developing secondary sex characteristics that don't align with your personal gender identity, and the societal pressure to dress and conduct yourself in a rigidly specific way based on the sex you were assigned at birth, and you have a recipe for disaster. I know this to be true because I was a trans youth who narrowly survived this. As a trans person who survived into adulthood, I have made it my life's work to make sure that each and every youth has the opportunity to thrive and become their true, authentic self. A recent study by the Trevor Project shows that more than half of all transgender and non-binary youth have seriously considered taking their own lives in the past year. This is the direct result of them not being loved, accepted, or affirmed, and the bullying that directly results from a society that seems to constantly want to punish them for simply being themselves. I am proud of the work we do at IYG. I am proud that we make sure that every kid has a place where they feel safe to be themselves. And I know that what is being proposed here today could have unspeakable consequences for these youth, for these children. Even with parents who love and affirm and accept them, and even with doctors who are willing, ready, and able to provide them with evidence-based medical care, the law will simply not allow them to achieve this. The law will not allow them to seek, again, evidence-based medical care that could very well save their life. This impacts parents as well. As the Inskeeps and the Clausens have already pointed out, this bill would strip parents of their parental rights to make medical decisions that are best for their children. Removing access to one of the few lifelines available in this state can and will drive youth to take desperate measures. For many of these youth, they will see suicide as the only way of getting out of this state that continues to persecute them year after year. In conclusion, I will leave you with one final statistic. Having a secure and affirming support system can reduce a youth's risk of suicide by 40%, as Christina Inskeep already pointed out. Now, part of this support includes medical care when it is needed. And we are talking about medical care that is based on the best available evidence and not denied because of stigma and misinformation. I thank you for your attention. I do ask that you keep in mind the rights and dignity of both these youth and their families today and vote no on SB 480. Thank you.
Thank you for your testimony, Senator Becker. And I have been generous with the 3-minute time frame. I'm going to be generous because we're going to go over an hour for the opposition. But we're still, if we continue this way, not going to be able to get the testimony from everyone. So I want to make everybody aware of that as we go past time. If we ask questions that really maybe we don't need to ask, we're affecting somebody at the end of the line that may not get to testify. So
I just wanted to make sure, are you representing an organization?
Yes, Indiana Youth Group.
Indiana Youth Group. Okay, thank you.
Thank you.
Okay, we now, thank you, have Dr. Struble, and then Killian Province, I think, and then Veronica Hedgerell. So, Doctor, welcome.
Thank you, Chairman Charbonneau and members of the committee. My name is Dr. Elizabeth Struble. I'm a family medicine physician from North Manchester. I'm speaking today on behalf of the Indiana State Medical Association. We appreciate our opportunity today to share our thoughts on Senate Bill 480. Many people, including physicians, have questions about the appropriate age to begin gender transition therapies, and the ISMA recognizes and respects that our members hold various opinions on this matter as well. In recognition of those opinions, the ISMA stands in opposition to SB 480 strictly on the philosophical grounds that we believe decisions about health care should be made between a patient and their physician based on the unique needs of that patient. Physicians are the most highly trained members of the healthcare team, and part of our rigorous education and practice is development of sound professional judgment grounded in evidence-based decision-making. Blanket policies laid out in statute, regardless of the underlying policy or context, necessarily limit that professional judgment and may have consequences beyond those intended by well-intended public policies. Accordingly, the ISMA believes that healthcare decisions are best made by patients and their families with the advice of physicians using their professional judgment and training. In short, the ISMA stands in opposition to SB 480 on the grounds that it is a limitation of the patient-physician relationship, but we do acknowledge that our members hold various opinions on gender transition therapies and the appropriate age at which they should begin. Thank you for your time and attention. I would be happy to answer any questions.
Thank you, Doctor. I appreciate your testimony.
Thank you.
Okay, next we have Gillian, and then Veronica Pedrill, and then Noah Cash. And again, I don't know if you were in here before, 3 minutes, and we're going to start holding to the time so we can get more people in to testify. Okay. Thank you.
Hi, my name is Killian Province. My pronouns are he, him. I am a 16-year-old trans man. I haven't seen many people up here who this bill would actually apply to. I think that everybody who has opposed this bill has spoken. Thank you so much. I know that me saying that I am a trans person puts my safety at risk being up here in front of possibly hundreds of people out there or watching at home who will watch this recording. And this is honestly one of the scariest things I have ever personally done. I shouldn't be up here in front of a room of adults telling you not to pass this bill that is going to kill kids. There's an 80% of transgender people who have considered killing themselves, me being a part of that 80% due to not having the right resources to express themselves and facing discrimination. 40% of trans people have attempted suicide. And among that 40%, the highest amount of that group is transgender youth. Banning gender-affirming health care for our trans siblings under 18 is extremely harmful. And what you are saying with this bill is that you are okay with kids considering or actually attempting killing themselves, with targeting families and doctors who are trying to save their children's lives. Gender-affirming care saves lives. I am not on HRT. I do not receive gender-affirming care. I would love to be able to have that opportunity. I do not. It is not what I am able to do at the moment. And I wish more than anything that everyone and anyone could get the care that they need. But that is not possible in the world already without this bill. This bill will forcibly detransition those of us who are already lucky enough to get the care that we need. We are kids, and we shouldn't be trying to save our own lives, our friends' and families' lives. I am 16 years old, and I have to deal with the things that I was already told that adults were supposed to handle. That is a lie. The adults that are here who are responsible for this bill are okay with kids considering suicide, are okay with kids not being able to express who they are, for being themselves. We already experience so much bullying and so much discrimination for simply being who we are. People who are considering passing this bill are the reason that people like Brianna Gay, a 16-year-old trans girl, is dead. And for other trans people have died in the past 2 months alone. And last year, 38 trans people were murdered for simply being themselves, for simply leaving the house and expressing themselves. As a kid, I leave the house every day knowing that I could be next and that I might have to defend myself for being who I am. And if I fail, I will die. And although I'm 16, I know who I am, and I have for a long time. Despite us being kids, we know who we are, and we know what you are doing. We know that you're trying to eradicate us, but no matter how hard you try, we are going to be here regardless. I am going to be here regardless, and you will not get rid of us. We are here for our rights, and not just to survive, but to live. And we're not going to give up.
Thank you very much for your testimony, and believe it or not, I was just told you got your 3 minutes, so you set that bar back to where it should be. So thank you. One question.
Thank you, Mr. Chairman. Shelley Yoder, she, her. So nice to meet you. I have a question. If 480, as you were saying, is harmful, what would you like? You're going to have an opportunity to influence future policy. What would be helpful? What kind of conversation should we be having today that would be helpful for transgender youth?
It would be helpful to have rules set in place to protect kids from bullying and violence for simply being who they are, and to be able to get the right resources if that is what the family and the child choose to do. As this is a discussion that should only be between the family, the doctor, and the child. It is not about anybody else. It is about the child and what is safe for them.
Okay, thank you very much. We are Veronica, okay, and then Noah Cash, and then Leo Ryan.
Thank you, Mr. Chairman, for the opportunity to speak out against SB 480, and thank you, members of the committee. Also, thank you, you pronounced my name perfectly. I'm Veronica Pedrill from Greencastle. I do serve on a few allied nonprofit organizations, but I'm here speaking on my personal behalf. I'm here to share my story by uplifting 4 of our common Hoosier values: hard work, family, faith, and service. My parents taught me that with hard work, I could grow up to be everything I dreamed of. 17 years of working hard to make good grades in school not only earned me a full fellowship at Princeton, it helped me distract me from the truth I knew from an early age, that I was a girl. Academics were my coping mechanism for my first crushing, suicide-ideating puberty. Years more work and a better second puberty later. I'm now a professor at DePaul. I live in a rural community that embraces me for the woman I am and all that I bring to the table. My parents were right. I can grow up to be everything I've dreamed of. But it shouldn't have to be so hard for kids like I was these days to become ourselves. My parents have passed on as I get close to 60 years old now. Now, as a proud parent myself of 2 Purdue grads who live and work in the state, cisgender children, I can affirm I have not been a social contagion to them despite all of the close contact we've had. I share that my sons and I treasure my unique family, our family values. Like many of you, my faith is central to all that I do. I'm a member of my Methodist church in Greencastle. I'm a member of a spiritualist church in Indianapolis, and I play piano almost every Sunday of the month at both of those churches. My last common value that I'd like to share is service. I proudly serve as an elected councilwoman in Greencastle. I placed my hand on my parents' Bible, and like all of you, I swore an oath of office to uphold the U.S. Constitution. I challenge each of you to reflect on your oaths today. Consider how this bill denies rather than secures the blessings of liberty for parents who support evidence-based standards of life-saving care for their gender-expansive kids. Like you, I place my hand on my heart and recite the Pledge of Allegiance as we begin each session in City Hall.
I'm sorry, your time is up.
Yep.
So thank you for your testimony. I do appreciate you being here. We're now into getting close to an hour and a half, and we still won't be able to get through everyone today. So I just want to keep going. Noah Cash, Leo Ryan, Nadine McSpadden.
Hello, thank you, Chairman and Committee, for allowing me the opportunity to come up here and speak. My name is Noah Cash, my pronouns are he, they, and I identify as a transmasculine, non-binary individual. I am up here today in severe opposition to Senate Bill 480. Not only are you taking away parental rights, of which Indiana is apparently all about, you are wrongfully silencing transgender youth who are already going through enough as it is. According to the Indiana Youth Institute, as of September of 2020, there's an estimated 43,000 LGBTQ youth living in the state. 7.8 of these youth identify as transgender or non-binary. In 2022, the Trevor Project reported that 45% of LGBTQ youth seriously considered attempting suicide in the past year, including more than half of those being transgender or non-binary youth. It is also found that 1.8 million LGBTQ youth seriously consider suicide each year in the US. That is one youth every 45 seconds, and it is partly in fact that there are bills such as these hindering their mental health. It is a hateful attack towards people who want nothing more than to live their truest lives. I can personally tell you, as I stand up here today, that if I had not received the counseling that was necessary, I would not be standing before you. I would have been another statistic to you. I have been the 45 seconds. I am 20 years old, and I remember first questioning my gender when I was 7 in the first grade, and I am scared, and I honestly still am. And I am outraged for the youth that this will affect. To them, I'm so sorry. This is not the Indiana that I know, yet I'm heartbroken to come to terms with the fact that it is. In conclusion, I beg you, I plead you, and I urge you to vote no to Senate Bill 480 to protect trans lives. Thank you.
Thank you very much for your testimony. Leo Ryan, Nadine McSpadden, Damian Ryan. And again, we better start shortening it up to 2 minutes because we're still not going to be able to get through everybody. So
hello,
go to it. Thank you.
Thank you for the opportunity to speak. I appreciate it. My name is Leo Ryan. I am a 17-year-old transgender boy. I have been receiving hormone replacement therapy for the past 2 years. This is a very long process. As Senator Johnson mentioned, transgender kids should be in counseling and should receive the mental health services that they need. And I wanted to stress that that does happen. Like, you don't go to Kroger and get testosterone over the counter. Like, I was in therapy for 2 years before I started testosterone. You can ask anybody who knew me before I started. I was a very awkward, quiet, introverted person, and now I am a lot more confident in myself. I'm much more confident in my presentation, my voice, everything about me. I just wanted to say that this bill would really hurt transgender children. I understand the position that it might be confusing for them, and I understand how a cisgender person might think that, but that's because it's hard to imagine waking up in the wrong body every day. It's hard to imagine that, and we don't have to imagine that. So I just wanted to stress that the decision to medically transition is not taken lightly. You speak with your family, lots of professionals, medical professionals, therapists. So yeah, that is all I wanted to say.
Thank you very much for your testimony. I appreciate you being here. I know it's difficult. Thank you. Nadine McSpadden, Damian Ryan, and Marina Barden.
My name is Nadine McSpadden. I'm here today as a mom and as a Hoosier in strong opposition to SB 480. I have a beautiful blended family, and one of my 4 teenagers is trans. Everyone who knew him from about the age of 4 knew that he was not going to follow a typical path. We spent a long time researching and learning and soul searching. We spent years working with therapists and medical professionals. We have taken every step intentionally and cautiously. We've been on this journey now for close to 10 years. We still work with a therapist and with a terrific team of expert medical caregivers at Riley. We now have an almost 14-year-old kiddo who is, by and large, thriving. He loves science and musical theater and has a strong group of friends. But even with full support, he still has challenges. Life as a trans person is hard. Life as a trans teen is virtually unimaginable. But I firmly believe that access to this excellent medical care is life-saving for him. I implore you to take 5 minutes before you vote today to put yourself in my shoes. Imagine you spent years learning and talking and agonizing about the path forward that you believe will be in your child's best interest, that you believe could potentially save his life. You've gotten guidance from experts, you've done all the right things, and as a team, you chart a course. But then the Indiana government steps into the doctor's office with you, and your legislators tell you that you don't know what's best for your child, but they do. I decided to come here today for 2 reasons. First, to remind you that parents of trans kids are no different than any other parents. We're all just muddling through, trying to do the right thing for our kids. And trans teens aren't the boogeyman, they're just kids muddling through, worrying about grades and friends and weekend plans. This bill will make our lives harder. Please don't move this forward. And the second reason I'm here today is to remind all the trans folks out there that there are so many people here in Indiana who see you and love you and are fighting for you. You're not alone, and we won't give up. Thank you.
Thank you very much for your testimony. Damian Ryan, Marina Barden, Richard Brandon Friedman. And I think we're getting close to the point where I'm going to have to cut off the testimony in opposition. So Go ahead.
Thank you. Good afternoon, probably now,
You have
everyone.
to speak a little bit louder. I'm sorry.
Sorry.
Yep.
Good afternoon, I think it is now afternoon, everyone. My name is Damian Ryan. I am 17 years old, and I am a transgender youth in Fishers, currently receiving medical gender-affirming care. I have known that I was transgender since 2017. I had just started puberty, and I was 11 years old at this time. I didn't know the word for being trans yet, but the feelings that I was having about myself and about my body were very real, and they were very scary to me. They persisted for years, and all throughout this time, I felt like I was living in an alien's body. It was not a body that belonged to me. I could hardly look in the mirror without feeling disturbed about what I looked like, what I sounded like, and that I was trapped in this body that I didn't belong in with no way out of it. That was how I felt before I started medical transition with testosterone. I began transition medically in 2021. I was 15 years old at this time, and it was the best possible decision that I or my family or my doctors ever could have made for me. The positive effects that this medication has had on me and continues to have on me to this day are miraculous. They've done so much for me. I've finally started to feel like myself from this medical care. I'm not afraid to speak anymore. I'm not afraid to look in the mirror anymore. I'm not afraid to be who I really am anymore. Childhood development is very, very important, and if you don't have this support in your youth, it will seriously harm who you become as an adult, and it will be irreversible to this youth. Thank you.
Thank you. Appreciate your testimony. Okay, we're going to do Marina Barden, Richard Brandon Friedman, Reverend Patrick Burke, and that will be the end of the testimony. So 2 minutes.
Thank you so much for listening to all those who are testifying today. My name is Marina Barden. I'm a senior at Shortridge High School, and I'm representing myself and my friends. And I was actually here on Monday, so congratulations to all the senators and representatives for getting the kids down to the State House twice in 1 week. I am here because I strongly oppose Senate Bill 480. None of the senators in this room are transgender, and neither am I. You and I are lucky to have our gender match our sex. We feel somewhat comfortable with the body we've been placed in, but that is not the same for my peers, my friends. Too many of my transgender friends and peers have hurt themselves, have attempted suicide, and some have even died because they didn't feel right in their bodies. Most of them voiced the desire to get medical assistance since middle school, freshman year, and sometimes even before those years. The ones that wanted gender-affirming services and got them are the ones that I get to see smile every day. None of you are transgender or openly transgender. None of you understand the pain of gender dysphoria, or maybe you do. Maybe during puberty, you didn't feel you were muscular enough to really be a man, or maybe your voice wasn't low enough. Maybe your body didn't fit into certain standards of beauty. That pain is real, and it is more real for the lives of many transgender kids. Trust that transgender children and their parents know what's best for them. Trust that they can make their own medical decisions. Trust that they will either wait till they're 18 or they will get medical assistance earlier. I know your hearts are in the right place. I know you want to help, but the people who really, truly understand are the ones outside with signs telling you to vote no. The ones that understand are the transgender youth sitting in school right now. It's not me, it's not you, it's them. They understand.
Okay, thank you.
Please vote no.
Thank you.
Thank you.
You're welcome. Richard Brandon Friedman, 2 minutes.
Thank you, Chair and members of the committee. My name is Dr. Richard Brandon Friedman, and I'm here on behalf of the NASW. I'm the chair of this Sexual Orientation and Gender Identity Committee. I'm also a licensed social worker who has been providing gender-affirming care for almost 10 years. The NSW represents the largest group of social workers in the field. Social workers are the largest group of mental health providers in the country. We're here to ask you to vote against SB 480. In my 10 years of work, I have seen the immense suffering of gender-diverse youth who come to me due to their dysphoria, and I've also seen the youth blossom as they receive the care that aligns their body with their gender identity. We've heard a lot about the mental health concerns. It's important to note that the bulk of these concerns can be traced to the social pressures and social harms, as well as their disconnection between their body and their sense of self. I've yet to have a youth come to me and say they regretted their care. What I see is youth who come to me fearful that their parents will withdraw the care or the state will withdraw their care. Gender-diverse youth who receive these supportive services have mental health outcomes similar to those who are not transgender. I want to be clear, mental health treatment is not enough. Medical treatment is required. It's unfathomable to me to think that all these professional organizations that we've heard about have issued statements supporting this if the research was not clear. Social workers do not prescribe medications, but we see gender-diverse youth. Having our hands tied about who we can refer to and what services may be offered is not only poor practice, but it's unethical practice. Our code of ethics demands that we base our practice on evidence, not beliefs. Not providing care violates these beliefs or ethics. While I understand that people in this room may mean well, I question the appropriateness of making medical decisions based on laws instead of clinical experience. I want to be clear, gender-affirming care helps youth, and preventing care harms these youth. Medical decisions about the best care for a youth should be made by providers, patients, and patients' families, not laws. We all want the same thing, Hoosier children to have access to the best evidence-based health care, and passing SB 480 removes that ability, and it will negatively impact the youth.
Thank you for your testimony. Appreciate it. Reverend Patrick Burke, thank you for being here. Appreciate your testimony. 2 minutes, please, if you would.
Thank you, Mr. Chairman, members of the committee. I'm the Reverend Patrick Burke, a priest at St. Paul's, Indy, in the Episcopal Diocese of Indianapolis, and one of the nearly 150 signers of the following letter that I'd like to share with you today. As faith leaders from across traditions and denominations, we strive every day to make Indiana a safe place to live, work, worship, and learn for all people, including members of the LGBTQ community. We write to you today unified by our deep concerns regarding bills introduced by the Indiana General Assembly that unfairly target the LGBTQ community, particularly transgender youth. As our elected leaders, your first responsibility is the well-being of your constituents. Above all else, your actions must first do no harm. But we continue to see harmful bills from the Indiana General Assembly, and the slate of hate is a disgraceful attempt at by a handful of politicians to score political points by harming children, teachers, and families they claim to represent. We ask you to ensure that no action is taken on any of these bills, and specifically SB 480 today. As clergy and pastors from a variety of faith traditions, we all share in common one religious value, God's commandment that we love our neighbors as ourselves. None of the record bills threatening our LGBTQ community are rooted in love of neighbor. As a wise preacher once said, if it ain't about love, then it ain't about God. We are especially concerned about the way these proposed bills will harm young trans people in our communities. We know these harmful laws threaten their physical safety and mental health by denying them access to evidence-based health care and erasing them from their schools. Across our diversity of faith traditions and backgrounds, we share the fundamental belief that we are all called to treat others with respect and love, and in that same sense of human dignity, we ask you, our leaders, quit making political pawns out of our LGBTQ friends, neighbors, and family members. Each and every LGBTQ Hoosier is made in God's own image, and all God's people deserve dignity and respect. We encourage you to join us in this public commitment to equality, respect, and justice for all by opposing this bill, Senate Bill 480. And a couple of personal comments as well. This letter was signed by over 150 faith leaders from across the state. This is an interfaith group that represents the breadth of faith traditions from Evansville to Michigan City, from Terre Haute to Richmond. We know from personal experiences of supporting young people and their family as they traverse this sacred journey of self-discovery that the care that SB 480 seeks to eliminate saves lives. The medical evidence supports this, and our experience as faith leaders supports this. I implore you, listen to the Hoosier doctors, therapists, and faith leaders who continue, in these powerful stories you're hearing from families today, as they share their experiences of pain and the sacredness of their journeys. Also want to make clear that our support for all of our siblings to live authentic, sacred lives made in the image of God will not waver, and that our faith communities are fully committed to loving all, to supporting young people and their families, and that we will continue to fight for all to see that the sacredness of their lives as God sees them, made in God's image and beloved, and especially on this Ash Wednesday as a Christian pastor, a day set aside in our tradition for us to recognize our shortcomings, our failures, and our sins.
Reverend Burke, I apologize and I ask for your forgiveness that I'm going to have to ask you to wrap her up.
Thank you.
Could we at least get a copy of the list of faith leaders who oppose?
Absolutely. You're welcome.
Thank you. We are now going to move to the proponents of the legislation, and the first person is Jeanette Cooper, and then Luca Hine, and Prisha Mosley. And I don't know if you have been able to hear the admonition of 3 minutes, please.
Yes. Good morning, honorable representatives of the great state of Indiana. My name is Jeanette Cooper, and I am here to state my support of SB 480 on behalf of Partners for Ethical Care, a secular, nonpartisan, all-volunteer, nonprofit organization. Parents are asked, would you rather have a living son or a dead daughter? It is the greatest fear of every parent to outlive her own child. It makes sense for a parent to choose physically harmful interventions when they are faced with that choice from unethical and misinformed healthcare providers. It makes sense for a mother to choose a sterile, de-sexed child over a dead child. It makes sense for a parent to consent to the removal of healthy breasts rather than the removal of her daughter's body from the morgue. It makes sense when a parent is surrounded by people repeating the mantra of life-saving care. The fear is immense and nearly unbearable. But this is the suicide myth, which assumes only two options, transition or suicide. It is a false dichotomy. There are always more than two options. But stopping normal puberty, administering wrong sex hormones, and removing healthy body parts should never be an option. Gender dysphoria is resolvable and is a psychological problem that deserves ethical psychological care. It is impossible to be born in the wrong body. The mind is part of the body. It is not separate from it. I help run an online group of thousands of parents who do not affirm their child's transgender identity. Rather, we support our children's social, emotional, and physical needs as human beings in their natural male and female bodies. We let our children wear what they want and cut their hair however they please. We are liberal, like me, and conservative. We are atheist, like me, and religious. We are former Democrats, like me, and former Republicans. I am not aware of any children of the parents in our group who have committed suicide because they were not affirmed. On the contrary, we observe hundreds of children who recover from gender dysphoria and thrive once they don't need the crutch of a transgender identity. Their underlying issues are addressed with ethical care. We know how to resolve gender dysphoria without destroying healthy bodies. In other private online groups, sadly, we read accounts from parents who affirmed their child's transgender identity, but their children's mental health still did not improve. We read accounts of committed suicides. We have read many, many accounts of this. The promises of transition joy did not save their lives. It was snake oil. There is no injection, not wrong sex hormones or anything else, that can be given to prevent suicide. Suicide prevention is about social and psychological supports, not surgeries. It's about changing your mind, not changing your body. No one needs gender medicine, and no one must kill themselves if they don't get it. This isn't life-saving care. There are 4 things that you need to have a completed suicide, and one of them is not legislation. In order to have a completed suicide, according to Jack Clott, a suicidologist of 45 years, you need to have hopelessness, aloneness, self-hatred, and the inability to cope. And I would like to note again, legislation is not one of those things.
Thank you very much for your testimony. Yes, Senator Donato.
I'm sorry, you were very difficult to hear, and it looks like your testimony was written. Is it possible to hand out copies of what you said?
Yes, ma'am.
I'm literally 2 feet from you, and I could not hear what you were saying. Not your fault, just a lot of noise. Would that be okay?
Yes, if you would
Yes, ma'am.
provide that, that would be great.
Yes, ma'am.
Luca Hine,
I have a,
Parisha Mosley, Karina Khan.
I believe there is a question.
Oh,
Thank
and
you,
then,
Mr. Chair.
Next in line is Senator Yoder.
Thank you. Thank you for your testimony. Do
Yes,
you
ma'am.
live in Indiana?
I live in Ohio. Oh, I was born in Ohio. Now I live in Chicago and in Illinois, so in neighboring states, Midwestern.
So I guess I would ask for the doctors that we've heard on care that is happening in Indiana, or the doctors, we've heard a long list of the academies that are saying 480 is harmful and best practice is gender affirming care. Are you saying that those doctors are lying or
Well,
practicing?
my understanding from the testimony is that you are not performing surgeries or doing any of these treatments on children under 18, so this bill should not be a problem to pass. Is that correct? That was testimony.
That is not the entirety of the bill, so to be clear. But I appreciate you reiterating that these surgeries on children are not happening
I didn't
in
reiterate
Indiana.
that. I was stating the testimony that was given.
Thank
So
you.
your question again was, am I suggesting that this is not life-saving care? That is correct. There's no evidence to that. This is not. I have evidence of thousands of parents whose children have desisted and they have not killed themselves. And we belong to groups online of tens of thousands of parents, and we are witnessing their suicides now because they have been harmed and they cannot bear what has been done to them.
Thank you. Luca Hine, Parisha Mosley, and Karina Khan. Welcome. Three minutes, please.
My name is Luca Hine, and I'm here today not only someone who went through the gender-affirming care system as a minor, but as someone who has been greatly harmed by it. I was a young teenager with a history of mental health issues, struggles at home, and who had been exploited and preyed upon online. This led me to spiral in my mental health with a hate towards both myself and my body, and I want to escape that at such a young age. The doctors didn't care about my comorbidities. They were swept aside. Instead, I was affirmed down a path of constant medicalization, one that I cannot undo and I will live with for the rest of my life. At 16, the very first medical intervention I ever had was a double mastectomy. A few months later, I was then put on cross-sex hormones. I am now 21. I live with constant joint pain to the point that it is so bad that I have not been able to get out of bed to go to class some days. My vocal cords ache, my breasts are gone, and I will never know if I will be able to carry a child because there's a good possibility I'm sterile. You call this care. I could not consent to this due to both my age and my mental health conditions, yet you call this care. My parents were baited with the idea that I would commit suicide if this was not given to me. They were told, would you rather have a dead daughter or a living son? These are not the words of a doctor. They are the words of a politically motivated activist. Kids deserve a chance to grow up whole. They deserve a chance at life, to get to know what it's like as an adult before that is taken away from them and they are made a permanent patient. They cannot consent to the long-term impacts of these things, and it is your job as the adults in the room to protect them from that. Thank you.
Thank you. Thank you for being here. Thank you for your testimony, Senator Yoder.
I just think it is important for this clarity. Did you receive the double mastectomy in Indiana?
I did not, but if you are implying that this care does not happen in every state in the United States, you are incorrect. Even if it's not now, by the time you wait when you have a detransitioner from your state, it's too late.
So this didn't, I just think it's an important piece of clarification that the double mastectomy did not happen in Indiana.
did not.
Thank you.
Okay. Thank you very much for being here. I do appreciate it. Prisha Mosley, Karina Khan, Justine Mercedes.
Can you hear me?
3 minutes, yes.
My name is Prisha. By the time I was 15 years old, I was suffering from multiple diagnosed mental illnesses, including borderline personality disorder and anorexia nervosa. I was suicidal, self-harming, and hated myself. These conditions and my age made me extremely impressionable and suggestible. It was at this time that the trans community found me and convinced me that all of my suffering was because I was born in the wrong body. By the time I was 17, I was being medicalized by a pediatrician with a high dose of testosterone. 1 year later, my healthy breasts were removed. The appointment with my gender therapist was only 15 minutes long. When I walked in, my letter of recommendation was already typed up on her computer, and she was filling in my name in minutes. I had been seeing a regular therapist for several years for my mental disorders. Even she said that all of my other conditions were caused by being born in the wrong body. My parents were lied to and manipulated by the same therapists and by my doctors. They were told to choose between a dead daughter and a living son. I had already attempted suicide by this time, and this was held over them as proof that they were not affirming me enough. Doctors said that if I was not medicalized, I would try to kill myself again. Testosterone caused severe emotional and physical issues. It made my emotions harder to control and understand, and even affected my sexuality. My body burns all of the time due to the changes it caused. My hips are so small that they cannot support the weight of my painfully overgrown shoulders. Being disproportionate like this causes constant pain and clumsiness. I almost lost my nipples after my top surgery. During this procedure, the nipples are removed, cut up, reshaped, and frozen, while the chest is scraped before being reattached to the chest. One day I pulled back my bandages to change them, and half of my nipples were attached to the bandages. I am missing pieces of them now. I experience phantom breast syndrome. It is the worst at night. When I'm lying in bed, there's an empty space against my scarred, numb chest. I feel my breasts as they were before being cut off. It hurts, and it adds to my grief. I also suffered hair loss on my head and hair growth on my body, which I have to treat with laser hair removal. My endocrine system is ruined. I cannot regulate my own hormones because of the years of testosterone abuse. On top of this, I am experiencing severe vaginal atrophy. It is painful, and it scares me. No doctors will help me fix this, and insurance is paying for nothing. I am turned away everywhere I go. There aren't even medical codes for detrans people, and no one to help us with our mental or physical suffering caused by transition. The medical system, which did this to me, has completely abandoned me. I don't understand how my doctors could look at the cuts all over my body and decide to cut me up even more. I'm covered in scars now, in a body that hurts and is not mine. There is no way to go back. I fully support a bill that saves children from so-called gender-affirming care.
Thank you very much for your testimony. Senator Yoder.
Thank you, Mr. Chairman. Thank you for your testimony. How old were you when you received the surgeries?
The double mastectomy was at 18.
So you were 18 years of age, and did those occur in Indiana?
North Carolina.
I'm terribly broken by your story. I just, in preparing for today, best practices is, it sounds like you were actively dealing with many. I appreciate you sharing the complexity of your case, and best practice would say, absolutely, definitely tending to these diagnoses before ever moving forward with that care. Having trans friends, I see adult friends, I see what they are going through, and just years of, not necessarily because of a diagnosis, but making certain. So I appreciate your story, but I want to reiterate this did not happen in Indiana, that you received your top surgery from North Carolina at the age of 18. So thank you for being here.
Yes, thank you.
Thank you very much. Appreciate your help. Karina Khan, and then Justine Mercedes, Michael Kelly. 3 minutes.
Thank you, Chairman. My name is Corinna Cohn. I'm here today in support of SB 480. I'm a resident of Indiana, and I'm in Senator Andrea Hunley's district. I moved to Indiana when I was 19 years old in 1994. In the winter of 1994, I had sex reassignment surgery in Neenah, Wisconsin. I was the second youngest patient operated on by my surgeon. I was too young to know what I was doing, although at the time I thought I did. I'm arguably the first person to start transition because of influence of the internet. Today, there are tens and thousands of boys and girls who receive all of the validation they could want, assuring them, and sometimes their parents, that the best thing they could do to become whole and healthy people is to take steps towards surgically removing their sexual organs. I'd like to tell you that I've lived as a woman for the last 30 years, but that would be a lie. I sought to change my sex, and it took me more than a decade to arrive at the understanding that I was trying to do the impossible. I did not live as a woman, but as a man doing my best to blend into the world as a woman. My heart breaks for the young people who are being lied to by well-meaning enablers, as they will need to learn the same painful lesson I learned. 3 years ago, I founded a nonprofit called the Gender Care Consumer Advocacy Network. I've spoken with patients and clinicians, and it's abundantly clear that there are numerous gaps in the care provided to young people who identify as transgender. You can count on groups like the ACLU to show up to protect the doctors who have no accountability to these children, but who will speak for these young patients? Which party traditionally cares about the rights of the marginalized? Which party has members who post signs in the yards that read, "In this house we believe science is real"? Which party has held itself at arm's length from concerns raised by a growing number of clinicians regarding the reckless trends in adolescent gender care? It is time for Democrats to step away from the shouting and misguided mob and come sit at the table with patients, policymakers, and clinicians who are trying to find reasonable solutions to a growing medical nightmare. Protecting children is not a partisan issue. In the past, I have spoken with policymakers in Indiana, Ohio, Alabama, and other states about the need to regulate the practice of adolescent gender transition. A year ago, I was urging them to focus on expanding the burden of liability on gender clinicians. But late last year, the World Professional Association of Transgender Health released new guidelines that were designed, in their own words, to absolve clinicians of any legal responsibility, regardless of patient outcomes. We Hoosiers should follow the lead of Finland, Sweden, and England in putting the brakes on transgender medicalization of youth. You will hear other people today say that the care is evidence-based, but the body of evidence is weak and contradictory. You will hear them say that it is science-based, and it has been the accepted standard for decades. This is a fabrication. Senators, if you were able to get past the smokescreen put up by the ACLU and the claims by a handful of self-serving clinicians, you'll learn that there is no evidence to support the current practice of transgender medicine on children. It's happening here in Indiana, and it needs to stop. Thank you.
Thank you very much for your testimony. I appreciate you being here. Justine Mercedes. Three minutes.
Chairman and committee, thank you for having me today. My name is Justine Mercedes, and I am the Indiana leader of the Parents of ROGD Kids. I understand how difficult it is to have a child in distress. We care deeply about children and want the best care for them, which is psychotherapy that will address all of their underlying issues. Putting a child on the path to sterilization and becoming a lifelong medical patient is not ethical, and it is not a parent's right. Parents are receiving misleading information. They are immediately told to affirm their child in the belief that they were born in the wrong body, no matter how young they are. The National Health Service recognizes that social transition as a form of psychosocial intervention and is not a neutral act. Parents are being told that puberty blockers and wrong-sex hormones are the best method of care. They're being asked, do you want a dead daughter or a live son? This is misleading information, and therefore parents do not really enjoy fully informed consent. This is about regulating an industry that experiments on children. The U.S. has not done systematic reviews on this type of care. Other countries, as you have heard, that have performed these systematic reviews have now banned this type of medicalization of children. We need to protect our children by following suit, and I graciously ask you to please vote yes and pass Senate Bill 480.
Thank you, Justine. I appreciate your testimony. Michael Kelly, then Justin Ratanya, Aaron Kay. 3 minutes, please.
Thank you, Mr. Chairman and members of the committee. My name is Michael Kelly. I am a licensed professional mental health counselor here in the state of Indiana. And I am here because of my ability to treat transgender disorder. I have treated both actually all three types, the androphilic, the autogynephilic, as well as female to male. The reason why I am successful at treating that happens to be because it appears that gender dysphoria, gender incongruence, is a matter of a disorder of the limbic brain. The limbic brain works subconsciously inside of people to create motivations and beliefs about self and identity that sometimes are not congruent with a person's gender, and we have found that to be true. The disorder happens to cause the brain to think that it is one thing while it is not. Gender dysphoria comes from a situation where people have experienced some measure of trauma in their life that does not get, that somehow gets associated to their gender, making it impossible for them to accept their gender. And that is why I've been successful in counseling these folks, because as we discover the underlying trauma that causes them to reject their gender, we discover that the trauma is the basis for the dysphoria. We also know that the limbic brain has two branches to it. In addition to causing a person to dread certain things of their life based on their feelings about it, it can also make people go after things that have been pleasurable in their life. This can create motivations or cravings for people, as well as trying to push other things that have been traumatizing out of their life. And as a result, these motivations that are subconscious cause people to begin moving in a direction away from their gender towards being something else. We should look at transgender not as a person moving toward their true identity, but away from their cisgender identity. And I guess that's probably all that I would want you to know about it, and I want to leave some time for some questions if you have any.
Okay, thank you. Senator Yoder.
Thank you, Mr. Chairman. Just so I heard you correctly, you're saying that, for example, the parents we heard from today, that their children experienced trauma if they were diagnosed with gender dysphoria.
Yes, that would be absolutely correct.
Is this your opinion, or is this is this based in peer-reviewed articles and research, or is this your opinion in your practice?
This is not an opinion. This is peer-reviewed research. It's common in the literature that, that trauma is highly correlated with gender identity disorder.
But you said that it's one and the same. If you're gender nonconforming, you had trauma.
Absolutely, that's correct.
My other question is,
previous trauma, and it is generally at least 1 year prior to a new belief that develops in the mind that I can no longer be the gender that I am. It's usually at least 1 year previously, but it can be longer than that. And puberty.
What source are you citing? Just because I would like to do my research. What source are you citing so I can do my research?
I'll have to send that to you. I don't have that. I could find it for you if you wanted me to take time.
Definitely. I mean, you're making a pretty large claim that I think for parents and for individuals, trans individuals, is a pretty bold claim.
Yes.
But I would appreciate that. Thank you.
Let me look that up for you.
Okay. Thank you. I do appreciate your comment. Justin Ritanya, Aaron Kay, Zandra Robertson. Thank you for being here.
Yes,
3
thank you.
minutes.
Thank you and good morning. I come here today as a Christian, husband, father, and physician to speak in full support of SB 480. And I applaud those before me with the courage to speak supporting this bill, especially those harmed by these abuses. It is my position that the permanent surgical mutilation and pharmaceutical poisoning which occurs being described as gender-affirming care poses a unique evil that sets children on a lifelong destructive path. Physician-led organizations such as the AAP, APA, AMA, and HHS have been politicized into compromising their oaths to do no harm and are no doubt complicit in the abuse of the very children they claim to be helping. Children are being groomed into these practices during the most confusing times of their lives and without the capacity of fully informed consent. Parents are coerced into making life-altering decisions for their children despite the fact that most children who experience sexual confusion will grow out of it by adulthood. WPATH themselves admit that studies to achieve realistic estimates on gender dysphoria are fraught with enormous difficulties. And for those with persistent gender dysphoria, the reality is nearly all of them have a litany of concomitant psychiatric disorders. Also, what we were once told was a rare problem has now in recent years seen a 10 to 20-fold increase in diagnosis in just a single generation, indicating that of a cancerous social contagion. To date, there exist no long-term longitudinal studies demonstrating the safety and efficacy of either drugs or surgery for gender dysphoria, especially on children. However, a 2011 study that followed subjects for 30 years did show a 20-fold increase in suicide rates 10 to 15 years after surgery. In fact, multiple studies in Europe have demonstrated the harmful effects of these treatments with no benefit, leading them to walk back much of these practices on minors. Even the U.S. Endocrine Society recognized the weak evidence and potential for harm, yet greenlit clinicians across the U.S. to perform these abuses anyways. These practices are in no way evidence-based. Yet gender clinics now are performing an unprecedented mass experimentation on children, starting with the off-label use of cross-sex hormones and chemical castration drugs such as estrogen and leuprolide, respectively, drugs that carry a long list of harmful and permanent side effects and once started dramatically increase the chance these children will proceed with surgical mutilation. Surgeries that have not been shown to decrease suicidality and carry with them innumerable permanent post-surgical complications. Bear in mind, people unfortunate enough to undergo these procedures are no closer to becoming the gender they purportedly feel. They are the same gender they were born and always will be, only now they are severely and irreparably harmed. I believe this practice on adults is barbaric and evil, so to experiment with this on children takes it to an unspeakable level. Gender dysphoria will always be a mental illness that requires psychotherapy, counseling, love, empathy, and guidance to heal those unfortunate enough to be afflicted. We must take action to protect children from the misguided adults claiming to help them, and that is why I stand to voice my full support for SB 480 to protect children. Thank you for your time.
Thank you very much for your testimony. No questions? Thank you. Aaron Kay, Zandra Robertson, Heather Scriba.
Good morning, Chairman Charbonneau and members of the committee. My name is Dr. Aaron Kay. I'm a family medicine physician here in Indianapolis. My views do not represent those of my employer, but I do want to say that the Indiana State Medical Association and many of these governing bodies do not represent me and a significant amount of my peers when it comes to gender transition, treatment, and surgery. I really don't want to be here. It's really intimidating for a new physician to come and speak on such matters with such tension, but I'm speaking to you because I love kids and I love the practice of medicine, and I take very, very seriously my vow to do no harm that all physicians have taken when we join the medical profession. My colleagues on the other side of the aisle of this topic want the same things for kids that I do. We want kids that are healthy, happy, whole. We want to treat them with compassion. Gender identity disorder deserves a full gamut of medical care, respect, compassion, care, everything that we need to give to these kids can be given to these kids. They need it. However, the current medical model of treatment, one that would be restricted by this bill, is not the best quality of care for these patients. The Dutch protocol, which is what most of these are based off of, involve puberty blockers, cross-sex hormones, surgical removal of healthy breast tissue, removal of the testicles and their ovaries, hysterectomy, and surgical removal and revision of sex organs. We know that I don't know how many of these actually surgical procedures are performed in the state of Indiana, but we do know that Riley Children's Hospital coordinates and counsels on these procedures as well. Many of these revisions cannot be done on children due to lack of tissue if they have not gone through proper pubertal development, which is stopped by these cross-sex hormones and the puberty blockers. These can lead to irreversible physical changes in infertility among a large host of medical issues that children are not well talked about along with their families going forward with this treatment. We prohibit children from operating a vehicle until 16. We place restrictions on sexual behavior. We do not allow them to vote until they're 18 and deny them legal alcohol consumption until they're 21. But we expect children and their families to understand the lifelong, irreversible effects of these treatments. Children under the age of 18 cannot consent to these. They're not able to consent to these. These medical protocols fundamentally harm normally functioning bodies and are intentionally causing disorder to normally functioning bodies, which is something that as a physician, I took an oath to not do. Over 80% of these children with gender dysphoria will come to accept their sex by the age of 18. That is well brought out in the literature. I highly suggest that each senator look at this expert report given to them today by Dr. Paul Hruz. Every single one of you guys is going to receive this. It has a ton of evidence that I believe everybody should look through. I will note that alarming a number of European countries, former leaders in the area of medical transition, are now actively walking back their recommendations for this treatment. The NHS in the UK has restricted the use of puberty blockers and cross-sex hormones to purely research settings, with Sweden and Finland following suit. Some researchers who brought forth that infamous Dutch protocol have been highly critical of the rapidly growing application of these findings. Their large focus now is psychological intervention and support for these families, which they need and they deserve. So as a physician that believes all children should get the best care that they deserve, please vote for SB 40 to protect our children. Thank you.
Thank you, Doctor, for being here for your testimony. Senator Yoder.
Thank you, Mr. Chairman. So you stated that European countries are banning gender-affirming care.
They're significantly walking back their recommendations. Yes, the NHS has brought back all of their medical transition.
But I think you stated that there are European countries that are banning gender-affirming care, and I just am asking you which European countries are banning gender?
Finland, Sweden, the NHS in the UK, New Zealand is walking it back as well.
So they're doing what, 480 in these countries that you're naming?
Even if they're not fully making them illegal, they're walking back their
So it's not
medical
happening.
restrictions.
So is it happening or not happening?
Well, they're walking back the restrictions, so therefore they're walking back their recommendations, so they're not happening as much.
But gender-affirming care is happening in European countries.
Yeah, but it's not the medical opinion. It's not the best medical opinion in their regard.
But it's the medical opinion. We've heard hours of testimony from, well, we'll just say the American Medical Association is in opposition to this bill. Are you suggesting that they're lying?
I don't think they're lying. I think that a lot of these medical establishments don't actually represent the majority of physicians that work in the United States in this regard.
And just to reiterate, the surgical care happening in Indiana, we've heard again and again and again, it's not happening in Indiana, but you're suggesting that it is.
I'm not suggesting that it is, but I know that Riley has on their website, I can pull up my phone and show you, that they do counsel and they say that they coordinate it. So I don't know the rate of these procedures in Indiana, but I know that they counsel and they coordinate it because it's on their website.
Thank you.
Okay. Thank you, Doctor. Zandra Robertson, Heather Scriba, Andrew Mullally. 3 minutes, please.
Good morning, Chairman Charbonneau and members of the committee. My name is Zandra. I am 31 years old, and for 10 years of my life, I identified as a transgender male. My gender journey began in 2010. My story began when I was young. I'm a victim of sexual abuse. The first time occurred when I was only 4 years old, and the second one was when I was 18, the same year that I made the decision to pursue gender transition. Growing up, I was emotionally immature and always struggled to fit in with either gender. In high school, common words used to describe me were dramatic or weird. I was socially awkward and faced a lot of bullying, especially online. I struggled with alcohol abuse beginning at the age of 15, and I struggled with body image and wore boys' clothing. When I became familiar with the idea of changing genders, it was easy for me to relate to the idea that I've always felt different from my peers. I knew I was attracted to women, I hated dresses and makeup, and I always leaned towards masculine interests and job roles. I sought transgender communities online, primarily on YouTube, where I learned about testosterone, what it does, and how to get it. At the age of 18, I made the decision to transition socially, cutting off my hair, changing my wardrobe, and binding my chest with an ace bandage. I did not have the financial independence to pursue medical transition, and my family refused to aid my transition in any way. However, at the age of 21, I sought out a doctor to inquire about testosterone. I was expecting to hear that I would need a letter from a therapist or proof that I'd been living as the opposite gender. However, all it took was a single appointment and the signing of a consent form claiming I understood the risk of the prescription. The price at the time was too high for me to sustain, and I temporarily stopped, though I continued to identify as a he and him. My mental health continued to suffer over the years, and I assumed my unhappiness and angst stemmed from my gender dysphoria. I was convinced that once I started and committed to testosterone, my life would somehow improve. I restarted testosterone at the age of 26 and continued it for 3 years. My muscles grew, my voice deepened, and hair appeared on my chin. I was passing, and throughout all these years, I never saw a therapist to discuss my gender dysphoria or the mounting depression and anxiety. The effects of testosterone created euphoria for a period of time, which eventually faded as the realities of this lifestyle sank in. I struggled to form and maintain relationships of any kind and became estranged from much of my family. I sunk into deep depressions where I would isolate myself in my apartment for weeks on end, medicating myself further with drugs and alcohol, and frequently I was suicidal. At the age of 29, nearly 10 years after my initial decision to pursue transition, I realized I was no happier than I was before, and the pursuit of transition had created more problems than it had solved. I will never forget the day I took a hard look in the mirror and realized I no longer recognized myself. As I began to question the sudden spikes in trans-identifying youth or whether I had fallen victim to a social contagion. It was after a suicide attempt in 2020 that I finally reconsidered my transition and sought serious mental help. I began to realize that my feelings of dysphoria were strongest around periods of my life that were difficult or traumatic, especially when the trauma was sexual in nature. Admitting my mistake after so long was one of the most embarrassing things I've ever done, and detransition was one of the most isolating and confusing experiences I've ever been through. I would like to emphasize that even as an adult, I was not in the state of mind to be making such drastic changes to my body by taking hormones. I can't imagine the struggles I would have faced had hormones and surgery been as easily available to me at 18 or younger as they are to many young women and teens today. The state of my mental health was not taken into any serious consideration by the doctor who prescribed me hormones, and therapy was never required. I do not think anyone should do this to their bodies, but least of all children and teens. I learned that it wasn't simply enough to identify as a man for a long period of time before testosterone. I did just that for nearly 7 years before taking it long term. I was still a teenager when I was identifying socially. It wasn't until I began to alter my body that I realized I was making a mistake, and the use of hormones has created side effects that I continue to deal with today. No teen or child has the capacity to understand the long-term physical, mental, or emotional consequences of this lifestyle, especially without documented or long-term therapy. I am thankful that surgery was out of my grasp for financial reasons, but other young girls in the future may not be so lucky, and for some it's already too late. My heart breaks for the girls in that position, and I fear for the youth that are pursuing this path. I understand all too well the kind of mindset you have to be in to want to change your entire self in such a drastic way. Those who are suffering deserve loving support and guidance, not simple affirmation. I would like to make a personal plea to the members of the Indiana Senate to please pass Senate Bill 480, which would protect children from experiencing the pain and trauma that comes from transgender hormones and surgery. Children experiencing gender dysphoria need real therapy, not experimental drugs, hormones, and surgery. Thank you for giving me an opportunity to share my story, and please take action.
Thank you, Xander, for your testimony, and appreciate it. Heather Scriba, Andrew Mullally, Matt Sharp.
Thank you, Chairman Charbonneau, and ladies and gentlemen of the Senate. My name is Heather Scriba, and I'm here today to share a glimpse of my experience wrestling with gender dysphoria. For most of my life, I wished that I was a boy and felt like I was born into the wrong body. It caused a significant toll on my mental health through bouts of depression, anxiety, and even feeling as though it would be a relief to die. These mental health issues brought me to seek professional counseling, where I was encouraged to transition, having met all the diagnostic criteria for clinical gender dysphoria. I pursued medical and social transition my senior year of college. I changed my name and gender marker legally, and I accepted the inevitable social costs that comes with coming out. The process of transitioning provided me with hope, a goal I could focus on, and relief that allowed me to be present for parts of my daily life that up until that point had been neglected. It wasn't until after I had top surgery, however, that I began to experience dysphoria at a level similar to that of pre-transitioning. At this point, my behavior spiraled, and I developed an unhealthy and toxic relationship with food and exercise, thinking that I could just make my body perfect, I would be able to once again alleviate dysphoria and not cringe at who I saw in the mirror. As I hit rock bottom, I began re-exploring why I felt the way I did about my body and self, which led me to find more professional and personal support to engage these questions from different perspectives, pursue healing from trauma, and find meaningful connections with safe people. I wish I had started with these steps, and I wish I had found them much sooner, because they catalyzed healing in me like nothing before ever had. I've since re-identified with my biological sex and given name, and I can confidently say that after pursuing healing in emotional, physical, spiritual, and relational ways, I am more comfortable in my own skin than I have ever been. It took much longer than expected, but the results are much more long-lasting and sustainable. I'm not sharing this morning with any intention of minimizing the very real and very significant pain that comes with gender dysphoria. I've experienced it, and I'm no stranger to it. I'm here this morning to speak of the very real and very significant pain that can come as a result of transitioning. The grief, regret, and pain that came as a result of the changes I made to my body were more overwhelming than I could have ever imagined. I can't imagine hitting rock bottom like I did as a teenager or even younger, and finding that the permanent changes made to my body and my voice would be scars and evidence of my journey that could never be fully hidden. Thank you, Mr. Chairman and members of the committee.
Thank you very much for your testimony, Senator Yoder.
Thank you, Mr. Chairman. Thank you for your testimony. Just for clarification purposes, how old were you when you had your top surgery?
As I said, my senior year of college.
So 21?
21, 22.
Okay, thank you.
Thank you. Andrew Mullally, Matt Sharp, Donna Lambert.
Thank you for letting me speak today in favor of Senate Bill 480. My name is Andrew Mullally. I'm a board-certified family physician practicing in Fort Wayne. I'd like to make sure that you are aware that the vast majority of the medical community looks with skepticism at transsexual hormone use and surgeries on minors because they are not necessary, they are not safe, and they are not effective. They are necessary because gender dysphoria spontaneously remits in the vast majority of those who suffer from this condition. Data from multiple studies report that more than 80% on average, the range is 50 to 98%, actually outgrow this desire to transition when they reach maturity and they willingly embrace their biologic sex. That is to say, the evidence shows that symptoms will resolve without hormones and without surgery. It does not make sense to perform an elective, cosmetic, and experimental treatment or surgery when symptoms will go away on their own. Furthermore, it is not medically appropriate to provide cross-sex hormones or transsexual surgery for a psychiatric condition. Most doctors would never participate in these damaging and unnecessary practices. Psychological conditions should not and are not otherwise treated with surgery or hormones. These surgeries in particular are not even very good surgeries on a purely surgical level because they pose an unreasonable risk to the patient. Complications for bottom surgery are more than 70% for female to male procedures and more than 30% for male to female procedures. These would be way worse than brain surgery and very comparable to the most dangerous open heart surgeries for complications. The risks of these surgeries would prohibit them from being performed for any other purpose except an etiologic one. Many people say that this is a rare issue and does not need to be legislated. However, just in January, in JAMA, many people have heard of that, they reported a 389% increase in top surgeries between 2016 and 2019. Admittedly, per Riley, not happening in Indiana, although it's on their website, but it's happening elsewhere, and we don't have to be the last one off the cliff. If we see the cliff, we can turn around before the cliff. This is certainly a social contagion for troubled youths that show no signs of slowing. On the whole, it's important to note that these surgeries are not effective at helping with gender dysphoria. Out of the studies available looking at these procedures, only a small minority look afterwards if people actually felt better, and the ones that found it did not find that. After surgery, suicide attempts actually went dramatically up in many studies that were quoted earlier, and I have copies available for you if you want to look at those studies. Similarly, even the UK eloquently stated in their current medical guidelines that cross-sex hormones had no benefit for gender dysphoric youth, but they did have significant side effects. Some of the limited studies available actually show that those treated with puberty blockers had worse dysphoria after the treatment than before they started. Those who advocate for cross-sex hormones and surgery are arguing from an ideologic position that is intentionally misleading, not supported by science, and offers false hope to truly suffering patients. Please be aware that any reported benefits are just assertions and are not scientifically proven or even supported by the current evidence. It is for this reason specifically that many European countries that have pioneered these procedures, namely Finland, Sweden, UK, France, etc., have officially and completely reversed course and have been working to minimize the use of these procedures. Please, because they do not help the patient or alleviate the symptoms they're intended to treat. In those countries, the primary treatment for gender dysphoric disorders for minors is psychotherapy and treating other comorbid conditions, which are very common, including trauma, autism, depression, anxiety, and ADHD. Lastly, it's important to know that pediatric patients cannot give informed consent for these treatment procedures. As we've talked about the shortcomings in decision-making ability, and it's currently legislated for tobacco, alcohol, firearms, tattoos, etc. This is supported scientifically by studies and evidence of ongoing brain development well into a person's 20s. The results of this have, we started seeing a large number of detransitioners who regret transitioning and are attempting to return to their native sexual phenotype. This is even starting to be addressed judicially, such as with the UK High Court that recently established that minors were not able to consent to these procedures in Great Britain, and they must be considered experimental for serious risks of irreversible harm and no proven benefit. As a physician, I'm in favor of this bill because these treatments are unnecessary, unsafe, and ineffective. Additionally, informed consent cannot be obtained. Most children outgrow this condition, that is a psychiatric condition, by adulthood, and that makes these treatments profoundly imprudent and unethical. The state has a profound interest in protecting this vulnerable population, and as such, I support this bill. Please pass it.
Great. Thank you very much for your testimony, Senator Yoder.
Thank you, Mr. Chairman. So how many surgeries are happening because this bill is just dealing with banning surgeries that are happening on minors under the age of 18. So how many are happening in Indiana?
Yeah, I don't do the surgeries, I don't know. Riley's website says one thing, they testified another.
Where does it say on Riley's website that they perform surgeries on minors?
We were looking at it 2 minutes ago, I can show you afterwards. It's on there currently.
It says that they perform surgeries
they do
on
coordination
minors.
And counseling for surgery at Riley's Children's Hospital.
Minors.
Children's Hospital, yes.
And so you're a physician. Do you use best practices, guidelines from the American Medical Association in other areas of your practice, but not this area?
When they get it right, which is becoming fewer and fewer times.
So what would you say, what informs your practice?
The studies, dozens, hundreds of studies. I brought a bunch with me hoping you'd ask.
But not the studies that we've heard from hours of testimony
Yeah,
from
I listen
the AMA.
to the testimony too. Most of these studies are internet surveys, like would pop up on Facebook, and most people scroll by them.
That is not, that
is the truth, and I have
these
those
are from
studies to show you.
peer-reviewed
Peer-reviewed means very
journals.
little in this world because there is really no strong evidence. All evidence is weak. The American Endocrine Society says this is very weak and in uncertain evidence. Uncertain is the word that they use, the American Endocrine Society.
Okay, we have to move on. Doctor, thank you very much
I'm here all day.
Your testimony. I do appreciate it. Matt Sharp, Donna Lambert, Jacob Stewart. 3 minutes, please.
Thank you, Mr. Chair and members of the committee. My name is Matt Sharp. I'm Senior Counsel with Alliance Defending Freedom, and I wanted to address a couple of the topics that have come up. Number one, the opponents of SB 480 are wrong that this conflicts with parental rights. Parents undoubtedly have the right to direct the child's mental and physical health care, but they do not have the right to demand that doctors perform harmful, unlawful services and medical procedures on their child. For example, a parent cannot demand that a 10-year-old child be sold alcohol when Indiana law forbids liquor retailers from selling it to minors. More seriously, a parent cannot demand that a doctor perform assisted suicide on their child in violation of state law. And a parent cannot demand that their child receive damaging, sterilizing hormones and gender transition surgeries if Indiana concludes that these are harmful to children. Parents have the right to decide which lawful medical procedures their child receives, but they do not have the right to expand the menu of legally available options. That's because courts have long recognized that legislatures have a duty to protect children from harmful things that they lack the maturity and experience to handle. For example, the Supreme Court's recognized that, quote, during the formative years of childhood and adolescence, minors often lack the experience, perspective, and judgment to recognize and avoid choices that could be detrimental to them. And that's why the state has the authority to regulate the medical field, authority that is even stronger in areas where there's medical and scientific uncertainty, like we just heard. As the Supreme Court just explained last term, health and welfare laws are entitled to a strong presumption of validity and will be upheld so long as the legislature simply has a rational basis, like protecting children from damaging procedures. Notably, Indiana already regulates some of these things. Testosterone, for example, in Indiana Code 1642-1925, prohibiting testosterone from being used for the purpose of, quote, enhancing performance in an exercise, sport, or game. That's simply what this bill is doing, is recognizing that the use of testosterone and these hormones for the purpose of gender transition is harmful and unethical and not something that should be given to child. Once they reach adulthood, adults are able to make those decisions, children are not. We also heard about other states. I think it's worth pointing out that several states have passed laws doing this. Most recently, Utah and South Dakota have passed laws. Mississippi just passed one that's now on the governor's desk. And Florida has actually done this not only through their Department of Medicaid issuing a 400-page report where they looked at all of the research and a very detailed report concluding that the state should not pay for it. But then that was followed up by their state Board of Medicine and Board of Osteopathic Medicine, both declaring that the doctors in the state should not be performing this, that it is outside of the standard of care based on the evidence. And so based on all of that, Indiana is well within its authority and duty to protect minors from these harmful procedures. Thank you.
Thank you, Matt, for your testimony. I appreciate it. I should not look that way, huh? Senator Yoder.
Thank you, Mr. Chairman. What group are you from, Matt?
From Alliance Defending Freedom.
Do you live in Indiana?
No, we're a national organization that is litigating on many of these issues, including helping to defend these laws in other states.
So this law, you're saying, is sort of making its way state to state to state?
That's correct. There are other states that are looking at the evidence and likewise determining that they need to protect their children from the harms of these procedures.
So even though we have heard hours of testimony saying that gender-affirming care surgeries are not happening on minors, you're saying the doctors we heard from are lying?
I'm not making any such claim. I think when you look at this legislation, it's focused on three things. Number one, puberty blockers. Number two, cross-sex hormones. And number three, surgeries. And saying that for minors, the state's concluding that based on the evidence, what we're seeing from not only Europe, but even the studies, like I said, that Florida was looking at when it decided that these are outside of the standard of care, that those should not be available to minors, just like Indiana does in a variety of other areas, concluding that certain things minors lack the capacity and ability to understand and properly consent to. So all the state is doing is saying, for minors, these are not available. Once they reach adulthood, they can weigh the pros and cons of all of that and trying to protect them. And that's what the other states are looking at as well, looking to protect minors from the harms of these procedures.
You also used the phrase, parents dragging their children and demanding that they receive this care. We heard from physicians offering this care. And I think I actually even asked, is there ever a situation where the parents are asking for more care? And the answer was no. So are you saying that physicians in Indiana are lying?
Again, I was specifically responding to questions about parental rights and specifically focusing on whether parents have the right to demand access to harmful, unlawful services and procedures that Indiana and other states have
parental
outlawed.
rights.
No, I'm saying parents absolutely have the right to make medical and healthcare decisions for their children, but that does not include the right to demand access to things that the legislature declares unlawful, like assisted suicide. Parents cannot say, I have a right to obtain assisted suicide for my child because
We're
Indiana
not hearing
has
assisted
rightfully
suicide
determined.
today, although some might wonder. We're hearing 480 today, and I just wanted to clarify.
And again, the legislature is weighing the evidence and deciding that it, like assisted suicide, is harmful.
Thank you. We need to keep moving. Thank you for being here. Donna Lambert and then Jacob Stewart. Donna, thank you.
Thank you.
3 minutes, please.
Hello. I'm sorry. I'm the mother of a child who is on cross-sex hormones that has questions about the safety and efficacy of medical treatment being administered to children presenting with gender dysphoria. As a co-founder of a parent support group with thousands of parent members, there are parents that love their children and absolutely wish to do the very best thing for their child. The one constant and concerning issue these parents experience is upon seeking care for their child, they're given one option: transition their child, or you're going to be the cause of your child's suicide. These parents are often told this in front of their child. They must jump on a pathway of medical intervention, putting their child on a medical intervention for life, and they're given no other options. That backs parents into a corner. Again, get on board, and if you don't, these parents are vilified in ways no parent should be, especially not from professionals claiming to have the best long-term medical outcomes at heart for their child. We've heard studies from all sides in an effort to prove their belief to be absolute. To that, I wish to point out that the fact is, this has never been done before. Never before in modern medicine have kids and teens been put on puberty-blocking drugs and cross-sex hormones. So the reality is, we do not know what lies ahead for these kids. There are no long-term follow-ups for these patients. And by that, I mean 10, 15, 20 years from now to see the long-term effects of these treatments. This is not about hate or anyone having a personal vendetta seeking to harm kids. We're not confused or fearful of kids that identify as transgender. They're our kids, and we love them. It is my hope that all kids receive treatment which is ethical, backed by robust, long-term scientific data that ensures the best possible lifelong outcome for all. Again, we're trying to do the right thing for kids. As you heard, far too many are not having the positive outcome they were promised. If you consider that to be a rare outcome, it's a rare outcome until you or your loved one is in that number of rare adverse results. Lastly, for a state that emphatically maintains that they're not performing surgeries on minors or passing this bill should not be a problem for lawmakers. Thank you.
Thank you, Donna, for your testimony. Senator Yoder.
Thank you, Mr. Chairman. Thank you for your testimony. Do you live in Indiana?
I do not. No, ma'am.
Okay, thank you.
Thank you, Donna.
Thank you.
Jacob Stewart. Jacob, welcome. You're the last.
Okay. So, a little tall, sorry guys. So, in Indiana, you can't purchase alcohol or cigarettes until you're 21. Minors can't buy handguns either. That's federal and state law. That may not mean much coming from me. I'm just a neuroscience student at IUPUI. But let me read you something from the National ACLU website that I read outside while I was waiting to testify. On the ACLU website, that's /news/civil liberties/ACLU's position on gun control, raising the minimum age for all gun ownership to 21, currently the legal age for purchasing a handgun, also raises no civil liberties issues, as research on brain development shows that young people's impulse control differs from that of adults. In another place, /other/juveniles and death penalty, they say, scientific information demonstrates that they, that is minors, cannot fairly be held accountable to the same extent as adults. Studies by the Harvard Medical School, the National Institute of Mental Health, and the UCLA's Department of Neuroscience finds that the frontal and prefrontal lobes of the brain, which regulate impulse control and judgment, are not fully developed in adolescence. Development is not completed until somewhere between 18 and 22 years of age. These findings confirm that adolescents generally have a greater tendency towards impulsivity, making unsound judgments or reasoning, and are less aware of the consequences of their actions. So even the ACLU, the Indiana chapter of which organized the protest outside, recognizes there are some differences in brain development between a minor and an adult that warrants treating them differently for their own protection. Like many of the people outside, I am here to protect youth struggling with gender dysphoria. But it isn't compassionate to allow them to make a life-altering decision, especially not before they know the facts and before they are mentally capable of assessing the risks of so-called gender-affirming care, from puberty blockers to cross-sex hormones and gender reassignment surgery. Obviously, this excludes the physical disorders that your bill made an exception for. The medical profession doesn't classify gender dysphoria as a mental disorder. Gender-affirming care is not treatment, it's butchery, and if the activists outside thought about that for a moment, they would hopefully question the motives of the doctors that perform such procedures with inconclusive and often contradictory evidence for effectiveness. The statistics on suicide that some of these testimonies have shared are an absolute tragedy, but they don't tell the full story, as those struggling with gender dysphoria have a much higher rate of psychological comorbidities, which they recognize. Yet the medical establishment is somehow okay with providing this imprecise care rather than focus on promoting coping mechanisms or social support. It's baffling to me. In 2021, the market for gender-affirming care was $1.9 billion. I guess doing so would mean a big cut to their paycheck. And I'm just a college student, not an expert. So of course I can be wrong. But my conclusion is that parents are being deceived and abused by a medical establishment that prefers activism over ethics, an establishment that is okay with using their children as lab rats. This is a horrible realization as someone who for so long has respected the profession and until recently hoped to join them someday. I mean, for so long the physicians told us puberty blockers are non-reversible. Now more and more evidence is coming out for the long-term effects on mineral bone density.
Jacob? 3 minutes. So.
All right, I just have one more paragraph. I'm almost done.
You got 4 sentences. How's that?
The culture absolutely demonizes anyone who questions their children, and in some cases even accuses them of abuse, or presents them with the false dichotomy of allowing medical transitioning or being to blame for their child's suicide. It's just not accurate, and it's just not right, which is why this bill is necessary to make sure these kids are protected until they are able to decide for themselves and make sure their parents aren't put in a position where they can be demonized.
Thank you very much for your testimony. Appreciate you being here. Senator Yoder, one question, and we have to move this bill.
You stated that in Indiana, an 18-year-old cannot purchase a gun.
Right.
That's not true. And actually in the state of Indiana, a minor can use a handgun with consent of a parent.
Right.
So I just wanted to clarify that.
Okay.
Thank you.
Thank you very much. Thank you for your testimony. That concludes the testimony. And Senator Tyler, would you, would you care to make some closing comments?
Quick close.
Do you have a question? Oh, okay. Yeah, if you would, please. And if anybody has any closing comments, maybe we'll take those before you close. Any final comments from anyone? Senator Becker?
Yeah, I just wanted to make sure that we address the Jewish community's concern about circumcision. I mean, it doesn't say it. It doesn't specifically exclude it, and I think that's a concern.
In the bill.
Where is it in the bill?
Okay, if it's in the bill, he can show you when we're done. Senator Bohacek?
Sure, and this is all about the bill. So histrelin acetate is an implant that lasts for 12 months. I think your bill says that they have to wean off the treatment within 6. Is this going to force the removal of the implant? Yes, it does, or no, it doesn't?
It would take the removal.
Get your...
It would remove, they would have to remove them.
So they have to pull the implant within 6 months?
Correct.
So they'd have to, wow. If a child went out of state, so if the child went out of state for treatment with their parents, without the recommendation of a doctor, to a state that does allow this, how would that be impacted?
This bill is focused on physicians and practitioners.
Okay, so if the parent decided they didn't want to remove the implant, then they wouldn't have to do it. What if, I mean, if they're being treated by a doctor here in the, here in the state of Indiana, and the doctor says, okay, well, you have this, we just put this in this month, you got to come back in and remove it. What if the parents say no?
Then it's up to them. This is about physicians providing the treatment.
So the physician, I mean, how does the physician make sure that they don't get in trouble for it? I mean, does it provide some kind of notification to the parent so that way, it's not going to jeopardize their license? I mean, what's the? Correct.
They can't continue to provide treatment past that 6 months.
Okay, but their license would not be in jeopardy. I guess what I'm asking is there a formal notification process they're going to have to give the parents to protect their own licensure? Because your bill doesn't have one in there, so you may want to think about that on an amendment, because there's just no space for it.
Happy to discuss it further. If it makes the bill better, I'm happy to
Okay,
to look at
all right, thanks.
All right, thank you. Senator Johnson, would you care to close, please?
I mean, for the sake of time here, I'm just going to ask and encourage you again to join me in protecting Hoosier children by supporting this bill. Mr. Chairman, please move the bill as amended.
Second. Okay, been moved and seconded. Call a roll, please.
Senator Bro. Senator Melton.
Explain my vote. Mr. Chair, for the reasons that many of the parents that came to testify before that allow parents to take away their private medical decisions with their children, I'll be voting no.
Senator Yoder.
I think I've thoroughly explained my vote at this point. No.
Senator Bush.
Aye.
Senator Donato.
Aye.
Senator Brown.
Yes.
Senator Bohacek.
Explain my vote. I am good with most of the bill. The only part I don't like is the part I expressed to you, and then also with the cross hormonal therapy is absolutely abysmal. Also, is the surgery. The puberty blocker issue gives me some pause to restrict that. It seems like it's a fairly non-invasive and very safe procedure. So I'm going to vote aye just to keep the bill moving. Thanks.
Senator Kreider. Senator Becker.
I vote. I struggle with this bill, but most of the support came from people that do not live in Indiana. And when I look at the American Medical Association, the Indiana State Medical Association, all the medical people and organizations are opposed to this bill. I also struggle with the inherent right of a parent to decide what's best for their children. And for those reasons, I'm voting no.
Senator Lysing.
Yes.
Senator Johnson.
Yes.
Senator Charbonneau.
Chair votes aye.
8-3.
Okay, thank you very much. The amended bill moves to the floor 8-3. I appreciate everyone that took the time to be here today, and I think most importantly, from my perspective, I appreciate the respect that everyone showed during the proceedings. Thank you very much. We have one more bill that we need to discuss, and Senator Melton, it's Senate Bill 433.
Thank you, Mr. Chair.
Maybe you want to wait just a
I'll
minute.
wait.
Yeah. Go ahead, thank you.
Thank you, Mr. Chair. Today I present to you Senate Bill 433 after much discussion with the chair and other stakeholders surrounding this issue. I know we're going to work out a pathway for the rest of the session, but I wanted to bring this bill forward because it is an extremely important bill for Northwest Indiana, not just my district, but the entire Northwest Indiana. Senate Bill 433 is a bill that would address both the short-term and long-term needs of health care in Northwest Indiana. The appropriation is made to help safety net hospitals in Lake County, who will see millions in reduction of federal support that many believe will be unintentional. I believe it's in the CARES Act, Section 203 in that bill, in terms of how there was a term change federally that shifted how certain safety net hospitals are reimbursed. And in Northwest Indiana, in particular at the Methodist hospitals, both in North Lake campus, which is in Gary, as well as the South Lake campus, which is in Maryville, there will be a reduction of nearly $16 million annually within that system. We're also hearing that the East Chicago Hospital, St. Catherine's, I believe, will have a reduction. There has been some constant tinkering in Congress with an important program called the Disproportionate Share Hospital Program, and the Indiana hospitals throughout the state stand to lose as much as $100 million a year in funding to support care, Medicaid, and Medicare beneficiaries. There's been a bipartisan group of congressional leaders, Representative Frank Mervan, Representative Bosch, and Pence have hard fought to try to fix this issue, but it has not been fixed. And we're hearing that there's not going to be a second look at this until later this year. So I thought it was best that the state of Indiana has some type of mechanism that will help in the interim while they're trying to fix this issue for this year. But this bill also asks for a study on how we can address this concern if it were to happen or occur in the future again. I'm focused on Lake County because, of course, it's my home, but also because it historically has been impacted through the safety net hospitals. We know that just recently the city of Hammond had a closure of a hospital and has shifted a lot of patients throughout the entire system in Northwest Indiana. Methodist hospitals in particular has seen an uptick, as well as community hospital. This is a short-term issue, and I hope that Congress will fix it in the future, but without the help right now, the bottom could fall out for many of our hospitals. Today we're going to have some testimony from the CEO, I believe, of Methodist Hospitals that's going to share their concern. There's been several articles and positions wrote from the Indiana Hospital Association, but this is going to be a major issue. I know we've had some issues in the Illinois Medicaid system that we've tried to address in past sessions, but this is going to shift the burden if we do not address this issue. And this is going to be, I'm telling you, a very dire situation if Congress doesn't fix it, but if we have a window opportunity to step in to fill in the gap, just in case that doesn't occur, this could save our hospital down the road. So again, I did offer, well, I have an amendment that would take out the appropriation in this bill, knowing that this Thursday or this week is the last week of bills being heard in appropriations. It still will have to be appropriated or sent to appropriations because there is a fiscal, because of the study itself. So in conversations with the chairman, and hopefully we're going to have a meeting later today with Senator Mishler, figuring out other options and opportunities within the budget as we move forward through this session. But I think it is very critical and important that we raise this issue and talk about it and have some concerns raised to figure out a long-term solution in case the federal government does not come through, because Northwest Indiana can sustain another hospital closure. So with that, Mr. Chairman, I'll take any questions.
Yes.
Brown.
Thank you very much. Yes, we passed a bill a few years ago to enhance Medicaid reimbursement to out-of-state So now you're suggesting we need to do something in-state because they need to get care closer to home? Is that what you're suggesting here?
I'm suggesting that because of the language change in the federal bill that I mentioned earlier, that it has tinkered with how we get reimbursed, and we are going to lose $16 million this year because of that fix.
So then if we do that and we enhance Medicaid within the state, should we then reduce offset by dollars we're sending out of state?
I'm not asking for an enhancement of Medicaid in the state right now in this specific request. I'm asking for us to have a fiscal study, a long-term study on these issues.
But ultimately, that's what you're going to be asking Senator Melton. And we've had these issues with Cincinnati, Louisville, wherever there are bigger hospital systems that offer more services. I mean, many of us on this committee toured the pediatric units in Chicago where some of our Hoosiers from your neck of the woods. But you also had a mayor in your county that wanted to sue the hospital that was failing and tried to sue to keep them open. I mean, at what point do we have to subsidize the hospitals and yet continue to subsidize care out of state as well?
I'm not talking about any other state but Indiana.
Well,
I'm not talking about
we
any
kinda
other
have to-
location but Northwest Indiana.
So it kinda matters.
The
It's the bigger
insinuation
picture.
that subsidizing, do you want Hoosiers to be without health care?
I
Do
don't
you
want
want
Hoosiers
communities to be without
healthcare. I want to be
a
make sure
hospital?
it's affordable.
Because that's what it's apparent, because you're insinuating that we want more when we want equity. We
No.
want things to happen and
I'm
occur.
not saying you want more. I'm saying we tried to help last year because Hoosiers were receiving care out of state and our Medicaid reimbursement was lower. And so we tried to fix that. But now it sounds like we're undoing that. And I just want to make sure because it seems to be a moving target.
We're asking for support for a couple of hospitals that we know inevitably, if it's not fixed, because of what Congress has done, that we know they will lose money. And we know that they could potentially close. That's what this bill is about. That's what the request and the conversation is about.
Senator Yoder and then Senator Bohacek.
Thank you, Senator Melton, for this bill. I think you're really highlighting some real concerns, and why we might look at this, at your district differently is we know there are higher rates of asthma, the air quality, water, there are real concerns, and this would help address some of those health concerns and getting access to care.
Absolutely. We know, and I know the recent data, 83% of the patients at Methodist Hospital are on Medicaid and Medicare. So to your point, yes, it's a lower poverty district and area, and that's the population that we serve because of high-end industry. Talk about contamination, when we talk about air quality, soil, when we talk about historic obesity, the lack of food deserts, or the actual food deserts, pharmacy deserts. I use my district as an example, the city of Gary, 52 square miles, almost 70,000 people, and we have one pharmacy. So we're talking specifically communities that will be impacted if we wait on Congress to fix something. And that's, to Senator Brown's questions, the reason why I'm asking for a study.
This is just a study.
And there's also an appropriation that I'm requesting.
Okay, good.
In the interim, in case Congress does not fix this issue.
Thank you.
Senator Bohacek, and then we'll move on.
Is this just for Lake County? Because you say Northwest Indiana, and Northwest Indiana is more than just Lake County, because, you know, I have problems in my community. I have a hospital in Marshall County, which has one hospital, 50 beds, and they're on the verge of closing as well for similar issues. So, I mean, I think what gives me a little bit of pause is we're just looking at Lake County. Is that all we're looking at, or is this other communities as well? I mean,
this bill itself, yes, it is Lake County.
Because it just says Northwest Indiana, so you may want to clarify that it's just Lake County.
Well, right now, this bill is Lake County.
Because the bill, as it's written, says Northwest Indiana.
Well, Lake County is in Northwest Indiana.
Well, there was a lot of other counties in Northwest Indiana as well, so.
Well,
yeah.
Well,
Thanks.
let me just close by saying this. In conversations and consultation with the Indiana Hospital Association, based off the amount of revenue we know that those hospitals are going to lose, and those that had come forth, this is the reason why I drafted this language.
Okay, we have one person here to testify that I know drove down from Gary today, so Matt Doyle, come up and kind of shed some light on this, and if you could, after all, and I'm not going to have a lot of sympathy for you because, well, you're going to do the same thing. I drove up and back yesterday, so you're going to do the same thing. Okay.
No, thank you.
Yeah.
And certainly thank you, distinguished members here today. My name is Matt Doyle. I have the pleasure to serve as the president and CEO of Methodist Hospitals. We're a two-hospital system located in Gary and Maryville, Indiana, and we proudly serve those communities. I think the issue that Senator Melton has brought up today is an extremely important issue. This is not an issue that's been created by the state of Indiana or an issue that's been created by specifically our hospitals. What occurred during the CARES Act funding bill at a federal level is there was a so-called corrective measure that was put into the calculation methodology of disproportionate share. That calculation methodology then is going to take away an estimated $16 million on an annual basis from our specific hospital system. And we're a little different than some of the other hospital systems. There's impact in other components in the state of Indiana, but ours is by far the most significant. And that's because of the amount of Medicare and Medicaid patients that we serve, specifically Medicare patients that because of income levels also qualify for Medicaid. So those are called dually eligible individuals. Those dually eligible individuals are being taken out of the calculation methodology. And so that's what has that specific impact to our facility. We operate at a loss, but we're able to manage to continue to provide services to our community. The concern is if we can't get the corrective measure done at the federal level, that this will be too insurmountable for our healthcare system to continue to operate. And I can certainly testify that $16 million is insurmountable for me to absorb in a system that's already operating at a loss. So that will cause us to make different choices. And those choices could lead over time to a significant closure or a reduction of services in some very important key service areas. With that said, we're working extremely hard in a number of ways at the federal level to get corrective language put in. The state of Indiana is leading that because we are so impacted. There are other states that we're trying to pull along in a consortium. I'll be in DC Monday, Tuesday to continue those lobbying efforts. And so what we're really looking for is to say if we can't get resolution in that short term at the federal level, that we want a stopgap opportunity through the state so that we can continue to operate and provide those services. And that study and the work that we're going to do and the important work that Senator Melton has talked about is going to hopefully provide us that stopgap until we can get the federal government fix in place.
Okay. Thank you, Matt. I appreciate any questions for Matt. Thank you for being here and
thank you, Senator.
Driving down. And we did have, or Senator Melton had an amendment. The intent of the amendment was to take out the fiscal so that we would be able to adopt that, and then it would end up being a study to look at the issue. Well, it didn't take all of the fiscal out of it, so and we got done what I wanted to do, raise the issue publicly so that the discussion can begin. And Senator Melton, thank you for bringing it. We're not going to vote on it, so would you care to make a closing comment?
Yes, thank you, Mr. Chair. I just want to make it clear that based off the conversations that you and I have had, we will continue to work on this session and looking at options within the budget to address this issue. And to Senator Bahachek's point, I think if it is going to be a study, let's be all-inclusive statewide and figure out if there are other hospitals that are impacted based off what is Section 203 of CARES Act. But I don't feel bad presenting something trying to help my district and trying to come up with a solution where we already have a section of the state that has been inundated with a variety of health issues as well as economic issues, and not to have the federal government come with a solution. As state senator represents this district, I thought it was most appropriate to bring this forth on behalf of my district. Now, I can't speak about any other states. I know the work that we've done in terms of reimbursement for children in healthcare across the state line, the border, and in Illinois, and which was admirable, and we did what we could there. But we're talking about something separate and different right now. So with that, I'm asking my colleagues, as we continue to work forward, let's work together, and as not like this adversarial type of situation, and have citizens lose out.
Okay. Thank you, Senator Melton. And with that, we are adjourned.